Dr. Jeff and Mariana run a lot of the medical processes that happen on site, everything from the traditional medicine team with ayahuasca and everything that's more Western medicine. So we have Carl chatting in. Let's see, he was here last year, coming back in January. Welcome, Carl.
Chad, what I do a little bit just to kind of mention that too is like as my doctorate in psychology so I have a psychology background. I'm the chief medical officer here at Rythmia. So Dr. Mariana is very unique in the sense that she's a medical doctor, but she also has training in holistic practices like breath work and plant medicine and a lot of really cool stuff, sound healing, meditation, yoga, all that kind of stuff that I am not an expert in at all, right? But a big part of like what we do at Rythmia and what I do in particular is just make sure that everything runs legally appropriate and medically safe and sound with our medical license that we maintain with the Costa Rican Ministry of Health.
Yeah, thank you, Dr. Jeff. So we have a lot of people chatting in right now from Wisconsin, Tennessee, Florida. We have a few from Australia coming in. Welcome everybody. So I'm curious if you're joining us for the first time, or if you've been to Rhythmia before. Have you been preparing for ayahuasca, or are you just now being introduced to it? Because based on who we have in the room and your level of experience, that will help educate us on how to best answer questions as we go through this presentation. So I'll give a little bit of an outline for how we're going to progress tonight, some of the things we're going to go over. And then at the very end, we'll have an unlimited Q&A. As long as people are asking questions, we'll be here to answer. So please chat in your questions. I'll be fielding those and consolidating them into different buckets so that we can make the best use of Dr. Jeff and Dr. Mariana's time here. So here's what we're going to get into today. First, how people and their brains get stuck in depression, and how ayahuasca then functionally resets the brain of people dealing with depression or other difficulties, and then how the Rythmia Way program helps people to reset their lives, and how to prepare for the program to have the most benefit. And after that discussion, we're going to dive into the live Q&A. And please feel free to ask questions, even if you feel like they're a little silly. I'll be the judge of what is silly and what is definitely helpful to ask. So even if you feel like it's not totally relevant, please ask, and then we'll do our best to answer all the questions that are coming through. So without further ado, Dr. Jeff, how do people and their brains get stuck in depression?
Well, one trait of depression is something called rumination. And rumination is the repeated kind of cycling of the same thought or a same behavior. And it's just nonstop, just this rumination on something. And so when people have depression, they're ruminating on negative self-beliefs. They're thinking, I'm not a good person. I don't deserve to be happy. Something's wrong with me. I don't deserve good relationships. And they're just like in this sort of spiral. And what happens with that is that we all know that if we think about something all the time, and if we're caught up in a way of thinking, then that can manifest in our lives. And we start to prove to ourselves that it's right. We don't deserve to be happy because we just got fired, or our spouse or our partner just left us. See, I'm not lovable. And so it starts to kind of manifest. So the struggle that people have with depression, especially with the rumination trait, is that they have a hard time coming out of that way of thinking about themselves. So the reason I really, really like the program we have going on at Rythmia is because it specifically addresses that trait of rumination in people that with the negative self-thought and self-talk.
Okay, excellent. So when you talk about people ruminating on different issues, can you give examples of how ruminations and that pattern, that process could also be experienced on the medicine as an opportunity to help heal and overcome that?
Yeah, so there's parts of our brain called the default mode network, and brain neurobiology is a very complicated section of medicine. And the reason is because there's a lot of theories involved there. We only know a little bit about the brain in medical science. And there's been case studies that have been done that have kind of been land breaking or groundbreaking. And we've had a lot of experience with a lot of different patients, like in the world of medicine. Now at Rythmia, we've had over 16,000 people come through here. So what we've been able to notice are some observations with the guests that reported being depressed prior to coming to Rythmia. So in the default mode network of the brain, these are various regions of the brain that have to do with how you view the world, how you view yourself. It's your consciousness. It's a wakeful rest state of your brain. It's kind of like where you default to with your thoughts. So if I'm daydreaming, or if I'm having, my mind is wandering, that's the default mode network. It's kind of where my brain just automatically goes to. And if I'm depressed with rumination, I'm in a negative space about me. I think that, like, I'm sad, I feel sad, I'm not good enough. And that's kind of where I'm stuck. And so what happens, the beauty of this program, with all the modalities that we offer, and we have a lot of different things we do, but the main one that we offer, our landmark sort of modality is ayahuasca. And the research that we're studying and looking at, and the articles that are coming out around the world, are looking at ayahuasca and how it resets certain components of your brain, and how it helps you overcome depression by adjusting the default mode network. So for example, in the vine component of ayahuasca, and we've talked about this before, like what actually is ayahuasca? It's a blend of two different plants. In one of the plants, there's something called beta carbolines. And beta carbolines are plant-based alkaloids or active ingredients. And these go into the body when you ingest it, you drink it. And then what they do is they allow a process to happen where you have visions, and you have memories, and you have an emotional release. So if I'm depressed and I'm ruminating and my default mode network is negative about who I am, what happens under the influence of ayahuasca is my default mode network will sort of slow down in that rumination loop. And then what will happen is I'll have a vision pop up or a memory. And some people have both. And they see themselves, or they remember when they were 5 years old or 6 or 7 years old. And they remember the climate and their environment they were in, whether it was, in their home or at school or wherever they were. And then they see things that led to this self-belief system of negativity that they're currently in as adults. And they see, like, as a kid, they're like, oh yeah, they remember things like my parents were not available to me, and I see that I really needed them. I was the oldest, and my new brothers and sisters were being born, and I felt like my parents neglected me and didn't love me. But as an adult, you can understand that that's not necessarily what happened. That's a childlike understanding. But because it was so impactful back when you were 5, it really set the tone for a belief system. And what happens when we have memories and experiences that are significant in our life, a neuron pathway gets formed in our brain that has an emotion connected to it. So for example, if I'm being abused or neglected as a kid, I feel that all adults are scary, or maybe just men, or maybe just women, or whoever's abusing me. Those people are bad. Those people are scary. That's like a survival technique. And that neuron pathway gets ingrained in me from a young age. And then over time, I reinforce that neuron pathway by having relationships that are not good. And I'm picking people to date or go on relationships, things with, that are not healthy for me. And I just keep adding onto the pile of just my belief system. And so what happens is, when you drink ayahuasca, you get to notice that. You get to see that that's where that stems from. And then there's something called a sigma-1 and a sigma-2 receptor. That's in the neurons of your brain. And that has to do with accessing your emotional memories. So the reason why ayahuasca is such a great modality for depression and for other things is because it can access parts of the amygdala, which is the subconscious part of the brain where we store things there, and it brings them forward. And then you can process them, you can feel them. And so, if I'm depressed and I'm ruminating on negativity all the time, but then I see that my depression is based in something that I've outgrown behaviorally, and that I've never really healed because I felt alone and neglected, I have the opportunity in an ayahuasca session to release that pent up emotional pain, and it surfaces, and then I feel it. and then I release it. And so in an ayahuasca session, people are sometimes crying. Sometimes people are yelling, right? They're yelling. But sometimes they're laughing too. So it's a very emotional experience that allows them to let this out. And so in so doing, the neuron pathways that you've established since childhood that are really ingrained in this rumination, they get recalibrated. So they open up and then they reset in a way that's more productive and healthy for you. Not only ayahuasca, but there's other psychedelic medicines that are becoming popular these days that do the same thing. But the reason ayahuasca is so powerful is because of the beta carboline component of the monoamine oxidase inhibitors that really allow this to happen. And there's a concept that we've all probably heard before called synaptic plasticity. That means that your brain can adjust and build new neuron pathways. So an example of this would be, if, like I was saying, if I don't trust men because I was abused as a boy by men, well, I can build a new neuron pathway once I've released that pain in a session with ayahuasca. I can build a new neuron pathway that says certain men are totally safe and okay. Not all men are that way. And I can get past it. And then I have to build confidence in that new way by then using tools that I have that I can communicate and open up and be vulnerable in healthy ways. So there's this whole process to it. But basically, to make it sort of simple, you're resetting your belief system about the trauma you went through, and you're releasing all of the pain that's led to your depression. And that's why this is an amazing modality to have people not go back on antidepressant medication, because to come to drink ayahuasca, you have to get off those meds for at least 30 days. Most people do not go back to their meds, which is an incredible awareness that we have as a company. We've had people report this to us as alumni of Rythmia. It's just a very powerful way to look at depression, because there's so many treatment resistant people to the traditional methods of depression, meds and therapy and EMDR and shock therapy and all kinds of stuff that they've tried, and nothing's working. This is a modality that is working for people, and we see it every day.
Hey, thank you, Dr. Jeff. That was perfect. And we've actually had, as you were talking, a lot of questions coming in specifically around trauma and how can you safely guide people through trauma under ayahuasca, right? Like using ayahuasca to help the traumas come up and then process through. Dr. Mariana, could you talk to that piece a little bit and how Rythmia and our shamanic team provide that safe environment to guide people through traumas?
Yeah, thank you, Chad. Well, a lot of the people that work here, they're very experienced and they have gone through the program itself, because it's very important sometimes to be able to guide these sessions or to help. They have to have gone it they have to have done some healing themselves, right? Because it's so easy to be able to help when you know a little bit where people are in their process. Of course, they have been trained with our shamans, with Taita Juanito that he brings the school here. And but overall, it's just like holding space, and not only during the ayahuasca ceremonies, but in our other modalities, like how we were talking about the Rythmia way, right? It's the principle, the first thing, and why people come here is to drink ayahuasca. But there's so many things happening around the program that helps people, because sometimes the medicine, it's like a bridge, right? And it's this tool that we're using to get to those healings, to release this trauma, to overcome whatever people come here to do. But sometimes also the parts of integrating what happens during ceremony are very important. So I think that's why, like, the Rythmia way, it's like very complete, because it's not only coming like to drink ayahuasca, but there's like so many classes around, even like the yoga, the breath work. It's all like trying to fit all these pieces together.
I think what's important also from what Dr. Mariana just mentioned is that, sometimes people get worried, like, they know they have some trauma in the past, and they're thinking like, I don't want to relive that. Like, that's really scary. You know, I don't want to have to go through that again. I've been in therapy. I've worked on a lot of it. I'm aware that it happened. So if I go and drink ayahuasca at Rythmia, am I going to have to go through all that again? And the answer is no, because the medicine, the ayahuasca ceremonies will meet you where you're at in your healing process. Things that are healed already. And your awareness you have. What it will do is it will just finely tune the last parts of your own healing. And so that's a nice thing to know, because I don't want to relive an abusive history. That's not something that is inviting to me at all. But what is inviting is the way that I'm living my life right now, because I'm guarded and I don't trust anybody. I really want to get past that. But the only way I can get past that is if I process what I'm holding on to from my traumatic history. And so the answer is you can handle it, because the ayahuasca is not going to get you to a place where it's so overwhelming you can't deal with it. You can. And it's a very safe environment with a lot of staff and a lot of people there that are ready to support you.
Yeah, and also
Well,
usually it's like what it's coming up are those emotions that we have already been like storing. So and we sometimes say that the medicine talks like in metaphors, right?
Yeah.
So it doesn't necessarily is gonna bring everything up like that. It's just about the emotion that is bringing. And as you were saying, Dr. Jeff, it's like picking up on like where you left off and where you started to pile up those emotions down.
Exactly.
thank you. Thank you. We're having a lot of people asking on that as I think they're visualizing, they're processing this trauma on the medicine. Like 15 people in a row just asked about purging. And it seems like there's a little anxiety around purging, or like getting nauseated and, vomiting. And they're asking, is there any way around that? Dr. Mariana, could you speak to that piece a little bit too?
Well, I would say that that's for there's different kinds of purges, but it always feels very good. Like you always hear about like people going to the bathroom and vomiting and all of this, and people get scared because I don't want to be uncomfortable and all of this, but at the end, this purging is like it's a psychosomatic release, right? It's all these emotions, all this trauma that we have been storing down, maybe since we were kids because of how we were raised, or what society told us, right? Like we couldn't cry, or even we couldn't express joy. Like how many times we have seen like a mother telling a child to like don't like make noise in a restaurant because people are gonna watch, and as kids we don't know what that means, and we just think like, okay, I cannot express joy, right? And that goes in any side of emotions. So we start suppressing all these emotions deep down, and they can even start becoming, like physical symptoms like lower back pain or headaches, or even like it can start being even bigger and bigger and start causing like autoimmune disorders, and all of this because we have so many emotions stored, because at the end also emotions are energy in motion, and if we're not shaking them, if we're not moving them, they get stored, right? And so when we come here and we drink ayahuasca, like this purging is releasing all these emotions. So yeah, sometimes it comes out as tears, as screams, maybe laughs, even the yawning, or also like vomiting. But all of that's happening is that we're releasing all these emotions or all this trauma that is stored in our bodies, right? So actually maybe you can feel nauseated, but after like you go and you puke, like you feel so good, because you're releasing all these emotions or all this energy that has been stagnant in your body.
Yeah, and our data shows that about 50% of the guests will throw up at least one time while they're here. So you have a 50% chance of vomiting, and other people will have a purge, like Dr. Mariana said, in other ways. I tend to yawn a lot, which is
Yeah.
which is a nice one. Or I go to the bathroom a lot. That's another one where you're releasing all this emotional stuff that's been pent up over your lifetime.
Dr. Jeff, could you also go through how to work through a scary and traumatic visualization while journeying?
Yes. So I like to use for this example, and I've had this question a lot, and you can imagine people are worried, I don't want to be terrified or be scared. So I always give a story about what happened with my wife, and I think it's very relevant for this question. Now, my wife, the first time she drank ayahuasca, she had a really scary experience, and she saw millions of spiders crawling all over her, and she hates spiders. That's like her worst thing in the world. Costa Rica is a tough place to be if you don't like spiders.
In Guanacaste.
Yeah, right. But anyway, aside from that, uh, my wife, as a little girl, had the fear that her parents were going to abandon her. Now that was an irrational fear because they never did. Her parents are amazing. She's close with her parents, but that was just a little girl's fear that she had when she was 3, 4, 5, 6, 7 years old. And it was just like something that she, it was just her little thing that she had when she was a little kid. She'd forgotten all about it because it would never happened. It wasn't relevant. And then she came and she drank ayahuasca. And then this fear of abandonment from her childhood surfaced. But her prefrontal cortex of her brain could not put meaning to that fear because she had forgotten about it completely. The amygdala wasn't really firing in the right way to help her remember. And there was like this irrational fear that had surfaced during the ayahuasca session. So what happens is if the memory is not along with that, the prefrontal cortex will kick into gear and it will say, we got to get rid of this emotion because it's not serving you and it's surfacing. So let's put a vehicle to it and get it out of here. And so what happened was the spiders showed up in her vision, in her sort of lucid dream state. And that's where the fear went and the fear left her. So a lot of times when there's scary experiences or, something that's like looks really fearful in an ayahuasca session, it's a vehicle. It's a vehicle to release an emotion. It's not something to be taken, in my opinion, it's not something to say like, well, that's a demonic experience or there's some sort of evil trying to get me and all that kind of stuff. It's not, it's just not what I've ever witnessed with our company. But I just think it's important to welcome all of those emotions and just realize that it's short-lived and it's a way to get fear and other things that you've been holding on to out of your system.
Thank you. Thank you. So we've had hundreds of questions, everyone. Thank you so much for chatting in your questions. We do have the chat disabled, but the Q&A is live, so please put them all in there. I've been documenting and listing them out so that we can get through all of them shortly here. But before we dive into specific individual questions, I think it's important that we go over the safety protocols that are important to consider when participating in an ayahuasca ceremony and different places, right? From underground ayahuasca shamanism in Los Angeles and Rythmia have very different standards. So, Dr. Jeff, could you go into everything that someone should consider safety-wise when participating or considering this type of medicine?
Absolutely. So what makes ayahuasca different than other psychedelics is that ayahuasca is a monoamine oxidase inhibitor. So what that means is there's a lot of contraindications that go along with MAOIs. And so medically speaking and prescription pharmaceutical speaking, antidepressant medication is contraindicated. So SSRIs, so selective serotonin reuptake inhibitors, and other selective neurochemical meds for antidepressant. Those are all problematic. So you have to be off of those for 30 days minimum. The other meds are benzodiazepines, which are anti-anxiety medications. So you have to be off of those for roughly 2 weeks. The other one is antipsychotics, Seroquel, trazodone. There's a lot of different ones, and you have to be off of those for 30 days. And then there's the stimulants for ADHD, Adderall, Dexedrine, Concerta. There's a lot of different ones. Those you have to be off 15 days. And there's other meds that are problematic, but those are the main ones. Also opiates for pain. You have to be off of those for 2 weeks as well. So there's a lot of different, health sort of medical prescribed stuff you have to be really careful with, and you can't be on it while you're drinking ayahuasca, or it can cause something called a serotonin syndrome. And a serotonin syndrome is very dangerous. And it's a flooding of the brain and the spinal fluid of too much serotonin, and it's problematic. You can have heart conditions result from that, and also different sort of really problematic health related things. So aside from the meds, if someone has a history of heart problems, like if they have an arrhythmia, or if they have stents in the heart, or if they've ever had open heart surgery, or ever had a heart attack, those are all contraindicated with ayahuasca. Also, if they've had strokes, or if they have any sort of severe liver or kidney disease, because when your body is processing the ayahuasca and going through the experience, there's a certain level of, you know, metabolism, and it's a taxing process in a certain way. While it is healing, your body's processing it. And if you have compromised liver or kidney or other organ systems, we have to be careful and take a look at that. Also, if there's a history of brain aneurysms or other brain conditions, that's something to look at as well. There's psychiatric conditions that are contraindicated. The first one is bipolar 1. Bipolar 1 is when the serotonin naturally in a person is elevated very high, and they're in a manic psychosis or a very manic state. And that's something that lasts for a while and then drops down into depression for a short time, and then they kick back up into a manic phase. That's part of how they diagnose bipolar 1. So that's a contraindication with ayahuasca, because there's just too much serotonin going on, too much up and down. And the other one is schizophrenia. People that have schizophrenia should not participate in ayahuasca, only because it's uncertain how that will react with their own sort of clinical state of their diagnosis. And it's just not something that's recommended to help people that have schizophrenia. There's a couple studies that were done in the past with people that had schizophrenia, and it just wasn't an effective treatment for them. So those are the main contraindications. Can you think of anything else, Dr. Mariana? I think that's pretty much it,
I
right?
think those are the big ones.
Those are the big ones. Yeah, those are the big ones. And what happens when you call our intake line to book your week with us is that they go over all this stuff in detail with you. They send you a lot of information, and you go back and forth with your booking agent, and then they contact our medical team down here to go over like meds and heart condition and all this kind of stuff. And then we make sure that you're really safe before you actually book your trip to show up in Costa Rica. Because if you come here, you got to know that you're going to be able to drink the medicine, right? So we have to make sure that you're safe before you book your stay.
Thank you, thank you. And can you also, Dr. Mariana, go through some of the different things that we do at Rythmia specifically to address the safety concerns that people have? Because that's one of the main reasons that we do get Western participation in the Rythmia program.
Yeah, well, Dr. Jeff can definitely tell you more in detail, but
Yeah, for sure.
but basically, the biggest thing, I think it's like the screening that is done prior, as Dr. Jeff was saying. Like when someone calls in to book a stay here, they're gonna go through some questions addressing the big issues to see if there's any contraindication for them to drink ayahuasca or not. But it doesn't end there. When they come here, they also have a medical evaluation with the medical team here, a nurse, a doctor, and they go through all of this again, basically.
Whole
And
triage process.
yeah,
Yep.
and in a little deeper, depending, on what's coming up. But that screening it's for people to be completely okay to take the ayahuasca. And they even take like their vitals. Everything is checked during that screening process.
Something that's important, Chad, also to, I think, mention to the audience is, because ayahuasca globally is not accepted in most jurisdictions, it's an unregulated substance in most of the world. Costa Rica is an exception for us because we have a medical license with the Ministry of Health. However, what that means is if you have somebody in a basement in Brooklyn serving people ayahuasca, well, there's no regulations on that person. It's actually a clandestine operation happening, and there's no way to know unless it's just somebody you're friends with or something that you trust. There's no way to know what's going on with that person that's serving that ayahuasca, where that ayahuasca comes from. And you're in a very vulnerable state when you drink ayahuasca. There's a lot of abuse internationally that goes on in ayahuasca sessions for everybody, women, men, everybody. And you don't want to be in a vulnerable place, especially if you're working on trauma or depression or any of these issues you're working on if you're going to be taken advantage of. And I'm always hesitant to recommend any place that serves ayahuasca that isn't a place that I know is safe. And there are safe places out in the world. There's lots of them, but it's hard to know what those are. And one way you can absolutely know for certain that Rythmia is a safe place is because we've been open for 9 years. We've had 16,000 people through here, and we're a medically licensed facility. And what better evidence can you have than that, right? So it's just to remember that, there's a lot of people out in the world, not just with ayahuasca, but with anything, that don't have your best intentions at heart.
Thank you. We're getting a lot of people asking about getting off their antidepressants or their SSRIs. Can you speak to that? And normally that would be something, right, that we talk about in the intake process with guest consultants, but we have enough people asking here that I think that could be helpful.
Yeah. So once you've been identified as a patient to come to Rythmia, but you're on meds and you want to get off the meds, first and foremost, we always recommend that you speak with your prescribing physician. That's the number one, because they're the ones that are giving you the prescription, and they're the ones that are going to help you taper. Getting off of meds is sometimes very difficult. There's a way to do it. Sometimes you add in certain new meds to help with anxiety as you're tapering off of the main medication. So it's not a matter of just taking a pill and breaking it in half and then doing that. It's much more involved than that. And in order to do it effectively, you have to get the physician involved that's prescribing you this medication. Now, I've been involved in tapers with clients. Now, as a psychologist back in Los Angeles, I was involved with the medication management of all my patients. And so I know the psychotropic meds very well. And in order to help someone go through that, you have to understand the person's biochemistry. You also have to help them with their symptoms that are popping up and that they're having. You have to really go gently. Sometimes you slow the taper down and you make it take longer than you were hoping. You have to be able to manage it, working closely with your physician and your psychologist if you have one. So like when I was working at Passages Malibu, which is a rehab, I was the administrative director of that place for 8 years. We had to get, there's people that came in there that had benzodiazepine addictions. They were on a lot of Xanax. You can't just stop that stuff cold. It's dangerous. So you have to be able to taper off antidepressants, taper off of benzodiazepines. There's a tapering process. Now, some people just stop cold, and it's never recommended to do that. It can be very dangerous. And when you come off antidepressants, in particular, your anxiety can climb. And all of a sudden you have this horrible anxiety. And there's a way to bring that anxiety down when you're tapering off the antidepressant medication. So that's something that's very, very important. So it's not a matter of just cold turkey stopping it. You got to get your doctor involved.
Hey, thank you. Okay, everyone, this is now we're going to be transitioning into the Q&A portion. We've had a lot of Q&A laced into this so far, but now we have list of pages of questions that I'll be getting through. So please keep asking your questions if you have a question that we haven't addressed up to this point. But now that we've gone through some basic understanding on depression, how ayahuasca impacts the brain, and the effects that people experience on ayahuasca in ceremony, we're just going to go through these questions, and I'm organizing them as best as I can. But as I'm trying to organize, they're a little, mismatched. So the first that I want to tackle here is around bad trips. We have a lot of questions about people nervous about a bad trip or like reliving traumatic experiences or even going crazy. It seems like some people have heard some horror stories on YouTube from different ayahuasca experiences that weren't, what people thought they would be. Dr. Mariana, could you address how maybe it could be perceived as a bad trip, and then how the Rythmia program helps people to work through those traumatic experiences that do come up?
Mm-hmm. Yeah, well, actually, in one course that I'm taking, they were talking about how it's like good to be rephrasing the bad trip to just intense trip, right? To like get out the negative connotation to it, because at the end, there's there's no bad trips. It's like whatever is coming, if it's really, really intense, it's like something that you have to go through, right? Of how we were talking before, how you have to, navigate through whatever the medicine is trying to get out of you. It's because it's there, it's stored. And at the end, when you decide to go through this path, it's because you decide the path of healing, right? And it's not easy. It's not easy at all, but it's a challenge that you're willing to take. So whatever comes through, even if it's really, really intense, it's just because you have to go through it, right? One of the things that we try to encourage a lot when during difficult or intense situations during your ceremony, it's to breathe. Like that tool is the first thing that's gonna get you through it, and that's gonna help you ground yourself. Because at the end, the breath is this grounding tool. So taking a deep breath in and exhaling really slow, that's always gonna help you, to get back to yourself, to center in. The breathing is always helpful, very, very helpful. Yeah.
I'm under the belief that you don't have to drag out your healing for decades and years and years and years. I believe that you can heal yourself quickly, and that if you are able to, that you should do that. Because in the Western model that we were taught on how to approach healing, in our traditional backgrounds in medical school and doctorate level psychology stuff and public health, I have a master's in public health, and in that as well, it's like if you have trauma or depression, that's a lifelong endeavor, is what we were told. That you're gonna have to be in therapy your whole life, you're gonna have to be on meds, you're gonna have to, go in and out of different facilities, to really deal with it. And I never believed that to be true. I felt like, sure, some people might need that, but most people don't. And the healing, when it's done efficiently and when it's done deeply in an environment that's safe, it's gonna be hard. It's gonna be difficult. It's gonna be challenging. I believe that this is 10 to 20 years of therapy in a week when you come to Rythmia. And so if that's the case, then it's gonna be tough. But you can get through it. You can deal with it. It's just a matter of realizing like what your goals are. And that's the beauty of our program, is that we offer intention setting classes. We have 3 main intentions we teach you that cover the basis for everything you're working on. And we help you, we provide support for you while you do your own work. And that's why it's such a powerful program.
Yeah. And also, I think it's very important now that everyone's talking about this, the psychedelic world, about set and setting. That's like 2 big things when you're going, into a psychedelic, um, into the psychedelic world. Because if you're, like we were saying, in a basement in Brooklyn, you don't feel safe, you don't know what's going to happen, you don't know if you trust the person, you're getting weird vibes, then probably your trip or your journey is going to be a little bit like that. Things like that are going to start coming in. But if you go to a place where you know that it's medically licensed, that a paramedic is on call, that a doctor is on call, that the people that are working in ceremony, they have been really prepared for this. Like, you start getting that sense of safety, and it's gonna be easier for you. Because at the end, also, it's very important to surrender, right? We talk a lot about surrendering into the process, but how can you surrender if you don't feel safe, right? So it's a little bit of that also.
Thank you. And we have some questions along this same line. Um, what if this experience with ayahuasca overrides the grief process, right? Because the process of healing, is there any chance that taking ayahuasca would be a shortcut that doesn't really work for the long term?
Well, I guess, anything in life can maybe not pan out the way we hope it does, right? But if you follow the guidelines that we've established with our protocols, the chances of you having a successful experience is very high. We actually collect data on the guest's experience, and the self-reported data report that about 98% of our guests every week achieve what they came here for. We call it getting your miracle. What that means is that they met the 3 intentions that we teach the guests. And so can the experience of ayahuasca be re-traumatizing, I think, is what they might be asking as well. And I guess anything could be re-traumatizing, but I haven't noticed that with our guests. I haven't seen that as something that is relevant. I believe in what's called a parallel process. Everything going on at Rythmia clinically for a person is relevant to their life on the outside because they're dealing with it here. This is a clinical setting. The way I was trained in psychology represents that even in a therapy session, what's going on in that session is clinically relevant. And so everything that happens here is in the ayahuasca sessions and the breath work and the yoga, everything, the food you're eating, everything is important and relevant. And I think that, the fear is natural to have. It's unknown, uncharted territory for everybody. And, most of our guests are first time ayahuasca drinkers. This isn't a seasoned veteran place. Now we do have alumni come back. 33% of our guests return because they want to go deeper. They want to bring their friends, their family. They want to, figure some more things out for their lives, or they hit a crossroads and they need some insight. So we have a lot of return guests, and that's a testament to how well this program is run. But everybody is a little nervous, because it's scary to face yourself. But you have to remember, it's just you. That's what this is. This is about you. And if things are scary, well, then you're a scary person. I had a really scary journey, my first ayahuasca session, but it's because I had parts of me that I hadn't really owned up to or accepted. And I got to see what that was. And then I got to choose the productive, healthy way to live. And so a lot of it's about self-realization more than anything else.
And let's get into a little bit about the process that someone would go through at Rythmia. We have questions that are asked about how many ceremonies are happening along the stay, what other modalities are included, a lot around the program. Could you dive into that and help people, envision what a week at Rythmia looks like?
Sure. So you want me to talk about that?
Yeah,
Okay, I'll get it. So you check in on a Saturday or a Sunday. You fly into the airport in Liberia Airport, Costa Rica. We pick you up. We know your name. We know who we're looking for. We bring you. It's about an hour drive. You get to the property. It's a beautiful double gated, super safe environment on the northern Pacific side of Costa Rica. Beautiful, lush area. And you come in. You get greeted by the concierge staff. You do a quick intake, and we give you some consents, and then you go and meet with the medical team, and you do a triage with the nurses, and then, as Dr. Mariana explained, there's a whole medical process. You meet with a medical doctor, and you go over everything to make sure you're ready to go. And then that evening, there's a breathwork session, and so you dive right in that first day. And so Saturday and Sunday evening, there's breathwork. And then Monday morning, the program starts officially, and you're in a class first thing in the morning, 9:30 a.m., and you're learning about how to set intentions, what the history of Rythmia is, why we became the company we did. Talks a lot about our founder, Jerry Powell, who was my client back in LA. He was a total nut job. And we talk about how he got healed through plant medicine. And it's a really fun story. If you haven't heard about it, I would recommend getting the book. It's about that process that we have on our website. So and then that night is the first ayahuasca ceremony, and it's Monday, Tuesday, Wednesday, Thursday night. Those 4 nights are ayahuasca for the week. During the daytime, you're a little tired, but we have classes of integration, and there's yoga every morning. You get 2 hydrocolonic cleanse appointments that are self-administered ozone infused water that's gravity fed cleanses that are really cool for your body and your health. And then you're eating this amazing food that's super healthy and organic, farm to table. It all matches something called the dieta, which is a shamanic way of eating for ayahuasca. So it's like there's no preservatives, there's nothing like, artificial in it. It's like really, really healthy food. And then after your 4th night is over, so it's Friday morning, then you have breath work on Friday evening, and then Saturday and Sunday again, if you're still here. And during that whole time, you're talking to people, you're meeting people from all over the world. If you get a little bit worried or nervous about something, you're confused, there's a counselor here that meets with you. Ben is our current counselor, Ben Decker. He meets with you. And there's a ton of staff to provide support. The medical team is always here. At night, as Dr. Mariana mentioned, we have a paramedic. He walks around, makes sure everybody's cool. And to be honest, our medical team is twiddling their thumbs most of the time because it's really safe. They're not doing a whole lot other than making sure you're safe, but we don't have a lot of real urgent emergencies. And the reason is because this ayahuasca is very safe. And if you're here at Rythmia, it's because you're medically cleared to be here. You're medically appropriate to be here. And so some of the strongest bonds that people form in their life happen here with other guests. People come back for reunions, you know, next year. They people get married that meet here. I mean, it's just like crazy. It's the coolest. It's a really cool vibe. We also have a Facebook group that we put you into for your week so you can stay in contact with people. So, you know, it's an amazing process that we've thought out very carefully down to the minute about what you're going through in your week.
Thank you, thank you. And how long do the effects of ayahuasca last? And I'm also curious between the effects of ayahuasca compared to just the effects of the entire program, because those are kind of two different questions, and we're getting both of those.
Well, you want to talk about the program? I'll talk about the ayahuasca. Okay, so if you're talking about like just like as a substance, the half-life of DMT, which is the active ingredient in ayahuasca, is 2.5 hours. Okay, so that means that it's not over in 2.5 hours, just the half-life of it is that. So it's about, you know, a 6-hour, 4 or 5 hour process. If you drink 1 cup of ayahuasca, you know, throughout the evening, you'll be feeling it, and then it'll fade by the morning, most people. And so if you do the whole week and you drink every night, those 4 ceremonies of ayahuasca, then you're feeling the effects of it for a very long time, emotionally and physically, but not as far as the substance is concerned. The DMT has already been metabolized and processed out of you after about 4, 5, 6 hours. So that's like the medical side of that question. And then the program related side about the, you know, like how long does this program stick with you? How long does this actually, you know, continue my momentum for positivity in my life? And how long does it still work for me? You know, this whole system.
I would say it's for life.
Yeah.
Once you go through it, it's like you open, you open that door, and there's, as Dr. Jeff was saying before, like there's always people that come back because they want to go deeper. But once you like walk this path, it's like it's with you, like forever. A lot of people, when they go back home, the journey continues because there's so many things we talk about. Having downloads when we're in the medicine. In Spanish we call them consultas, and are these downloads of information that we get, and sometimes it's during ceremony, but also when you go back home, it's like for at least like a month, like you were still like very active with the medicine, and it doesn't mean that you're gonna be tripping out in your bedroom. Those effects are gonna be over, but like the emotional and physical part, there it's still there with you. So that's why it's very important also the integration process, that now we have an app to help us with the integration when people go back home. And also Dr. Jeff, in the class that he teaches on Thursday, he talks a little bit of how people can navigate their integration process a little easier, right? Because the ayahuasca, it's like this gateway for healing, but then it's like you also have to put your side of the work, right? So it's like going back home and navigating your life, like your regular, this plain life, with whatever you experience during your ceremony. So yeah, definitely it's something that it stays with you. And maybe when we go back home, when we start with a routine, maybe things start, to loosen. It's like I like to say that when you drink the ayahuasca, how Dr. Jeff was saying, how these neuron pathways start opening up, right? If it's like a trail, right? If you keep on walking through this trail, then it's going to stay open. If you open a new one and you start walking through that pathway, then the old trail is going to start closing in. But if you start going into old habits or old patterns of thinking, then probably that trail is going to stay open. So it's like your part, like uh, um, your work to start opening this new trail so that the old pathway starts closing.
And how would you know if you're ready to drink ayahuasca?
it calls to you.
It's a feeling. It will call you.
I think, you know, there's a lot of different reasons people want to drink ayahuasca. There's no one right way or wrong way or whatever. I think there's multiple reasons and ways to know. Some people just say that there's synchronicities that keep coming up and they keep thinking about it. They might have tried a lot of different things already and it's not working. Like they might have tried therapy or meds or who knows, a bunch of stuff and it's just not working. I think it's for everybody that wants to really change and get back on the path that's their true self. And it's for people that, you know, they know that it's going to be a bit of a rocky road, but we want to get right to the point and help people heal immediately because life is short. We don't want to be in a state of depression. We don't want to be holding on to all this painful stuff from the past. We want to get rid of it and just move forward in a way to be successful and happy. So I think the way you know if it's ready, if you're ready for it, it's just like your intuition, your gut feeling. Like you got to learn to follow your heart. And in the Western model, you know, in the Western world, we're always intellectually thinking about everything and rationalizing it. And, you know, there's only so much that we can go in that way. But if you follow your heart and follow your intuition, and I lived in Hawaii for a while and worked for the government in Hawaii. And in Hawaii, navigation comes from the stomach. That's where people navigate culture, the Polynesian cultures. And in the outrigger canoes and in the hokulea, which is an old sailing outrigger that they settled all the Polynesia with from Tahiti. It's like they're feeling with their intuition, their gut on how to navigate the world. They're looking at the stars and following their intuition. So I think that's a powerful model, especially with this indigenous medicine of ayahuasca that's from Latin America, it's from South America, Central America, and it's very intuitive based, and it ties you into your true self. So I think the answer to that is, you know, when you're ready.
It's about the feeling.
And once you know, what do you do? How would you prepare for ayahuasca?
Well, the dieta is always good.
Yeah, starting with the dieta, calling our agents in Malibu, that's a good start as
Yeah,
well.
yeah, they're going to give you all the information you need to know. You know, they're going to give you an email that has lists of stuff to do. But I think, you know, if you take this seriously, if you take your healing seriously, then you will prepare seriously. You'll stop drinking alcohol in excess or completely eliminate it. You will not use drugs of abuse. You'll start to have a daily practice, something that can center you, something that can help you connect with yourself. You'll start to not watch ridiculous TV shows and not be on your phone all the time and just not be scrolling through social media all the time. And you'll start to have like healthier relationships and talk to people and be involved. Now, that might not be you. You might be feeling isolated and you don't want to talk to anybody. Okay, that's okay. But there's things you can do to center yourself through the way that you eat, the way that you think about the world, and just reducing the amount of negative stimuli that are constantly bombarding us.
Even just having, like what you said, a daily practice, like starting, even if like maybe you don't connect with meditation or yoga, but you know, just doing something for yourself. It can be like walking your dog or dancing or journaling. I think journaling is a very good tool of like what you can do before coming in, because it's like also it's gonna be recording all of your process. Then when you go back home, you keep on journaling. It's like a good thing, because also it takes a couple of minutes. Like you don't have to be journaling like a whole thing. You can just like, how am I feeling, like pinpoint an emotion, or what am I grateful for today, like something that is gonna start connecting you to that intuition and to like opening up into like this process.
And let's dive in a little bit more about helping people not fall back into old patterns. Because since we started the webinar, we've had about another 150 people join us since you explained the process with the amygdala in the beginning, Dr. Jeff. So could we dive into that quickly? How we release stuck emotions in the amygdala, and then how we can rebuild paths correctly moving forward with the help of ayahuasca, from the starting of the ceremony through post-integration.
For sure. So, you know, we have habits and behavior patterns that we've developed since childhood that we're currently utilizing now to live and do things that we do. Some of those behavior patterns and habits are healthy and good. Like I'm a hard worker, I'm always on time or whatever, but there's a lot of things that are not like that. I feel negative about myself. I feel like I don't deserve to be happy. I feel that, the only way I can get love is if I'm giving people money or something. Like there's all these just different beliefs in our lifetime that we've developed that are ingrained in us. And what happens when you drink ayahuasca is it goes into your body and it goes into the parts of the regions of the brain where all these ingrained belief systems and habits and neurochemical pathways are locked in, and it opens them up and it resets them in a way that's functional based on your mindfulness and your meditative intention setting. So the research that I've been reading and finding out about shows that if you're mindful about something in your life that you really want and you think about it and meditate on it and set an intention, there's a concept called epigenetics that a lot of people are finding out about. It's been around for like a decade and a half and longer than that, but the study of it at least. And what it's showing is that you can recalibrate how your DNA is being coded for with belief systems and all of these receptors that are being triggered with ayahuasca. So what happens is if your brain is like all caught up in all this negativity and these ways of thinking and behaving that aren't serving you anymore, you drink ayahuasca and it kind of opens that up. And then based on your intentions to be happy, to be healthy, to release trauma, to forgive people, to forgive myself, all of those neuron pathways then get set up. And then you start to have that synaptic plasticity moment where that's the new way that I'm behaving. And then I have to build confidence with the tools that now are new to me that I'm learning here at Rythmia. We teach you all these different strategies, and then you move forward in a way that releases the old way. So the new way, you have to build confidence in it. It's kind of like if you never trusted anybody, how are you going to build trust? You have to give people a chance. So you have to give yourself a chance. You have to slowly step into it, and then you build confidence. Oh, look, I didn't get disappointed by that relationship, or I got hurt, but it was okay because it didn't kill me. I'm fine. And you just start to build confidence in this new way. So you've recalibrated your neurochemical connections and you've released the old dysfunctional neurochemical pathways that were no longer serving you. That's why this is really impactful. And the data that we've collected 6 months after people have left Rythmia, we sent out a survey to everybody, shows this incredible amount of people that have not gone back to the old ways, that the medicine and the experience at Rythmia is working in their life and they're focused on this new way. It's incredible. And if you look at our testimonials on our website, on our social media, on TripAdvisor, it's just like incredible, the people's stories. I mean, it's just like amazing breakthroughs that they're having while they go through this.
Thank you, Dr. Jeff. And before I go on to the next question, I want to give the 332 people that are still on this webinar a shout out. Thank you for joining us tonight. We're going to be here as long as you have questions. But as I'm seeing all the questions coming through and the concerns and the raw life that people are expressing on the Q&A here, I'm feeling a lot of gratitude for everyone that's on the call now. If you're on this call after a full hour and you're still waiting to see if ayahuasca is right with you, for you, and if this is something that can help you in your life, even though we've been here for a while, I encourage you to stay with us. The three of us are going to be here all night long to answer your questions. I mean, like we'll have to cut it off eventually as people start nodding off, but we're here for you. So if you still are looking for that question to be answered and you're curious about whether or not this is right for you, this is a great time to recommit to staying with us and looking to hear that answer, whether it's something that comes from Dr. Jeff or Dr. Mariana or something that you feel internally, whispering to you. I'm seeing a lot of people chatting in on the Q&A saying that, oh, that's it. Now I know I'm ready to go, right? And different experiences like that. So stick with us and hopefully you'll have an experience like that too as we stay together. So the next question is this, and I'm just going to read it because it's pretty, I think, applicable to a lot of people. I've never been diagnosed, I don't have any meds. I'm just sad. Can ayahuasca help me too?
Definitely. Yeah. Like what we have been talking throughout the webinar, even if it's not a diagnosis on depression, it's like what we were talking about, how we start all these emotions. And what ayahuasca does is it's bring those emotions out, right? And also, I think we haven't talked about this, but how it gives like a different sense of perception into the world. When we drink ayahuasca, it's like we're always looking before we drink. It's like we're in a tunnel vision and we only see life in this way. And so that's why it maybe we're stuck in this pattern, and then we drink ayahuasca, there's brain synaptic plasticity, new neuron pathways coming up. And that's why people report that they see life differently, or that they see the bigger picture, right? It's because of these new awarenesses. And from that, people can work a lot, right? Because it's not falling into like my old habits or my old way of thinking. Sometimes it just takes that, like a new perspective.
When I was working in Los Angeles, almost all of my patients said one thing in common: I don't deserve to be happy. That's what they would say. And I was shocked by that. And there was just so much sadness that I was realizing is out in the world. The beauty of this program and of ayahuasca is that you become your own therapist. You become the person that empowers you through this process. That's why it sticks. If I did the work for you, or if Dr. Mariana did the work for you, it would help a little bit, but then you would just go back to your old ways because you hadn't internalized it and you hadn't made those neurochemical shifts and those behavioral shifts that only you can do. So what we do as a program is we create a safe environment and we point you in the right direction, and you become your own therapist. So if you don't have a diagnosis of depression, but you're just sad, that's a great reason to come here and get that handled and just put it behind you.
Mhm.
Yay, thank you, thank you. So what about addictions? One, is ayahuasca addictive? And two, what can ayahuasca do for people that are experiencing addictions?
I have a good answer to this. Okay. I'm the addiction guy
Yeah.
running a
You
rehab in
are.
LA, right? Okay. We're not a rehab, and you can't be actively using substances when you come here. However, people that in the 6-month survey, what they tell us is in the past, before coming to Rythmia, if they had an addiction history, and they were sober for a while before they came here, or, they weren't currently using when they came here, 62% of those people say that they have no cravings for their addiction whatsoever post Rythmia. So what that means is if they had an addiction history, they no longer feel that they're addicted after this program. And so while we do not specifically focus on addiction, we absolutely, as a program, help resolve some of those issues that lead to it. My clinical supervisor, Dr. Bobby Carlson, God rest her soul, an amazing psychologist, she told me, if you have an addiction, you have trauma. If you have trauma, you have an addiction. And so it's kind of like, which came first, right? So there's trauma involved in addiction. There's depression involved in addiction. There's anxiety involved in addiction. There's all the things that mental health issues that people struggle with, all wrapped up into one. So the short answer is this program absolutely will put the final nail on the coffin of your addiction based on what these guests that we have coming through here report to us. And the ayahuasca research that's coming out globally that shows that specifically alcohol and cocaine addiction in particular are eradicated for a lot of people that go through this program. Now, if you're an active user, if you're currently addicted to a substance or a behavior is a little different, but if you're currently addicted to something, you have to be detoxed in a safe manner. Even though I ran one of the biggest rehabs, most well-known rehabs in the world, I don't like rehab at all because the numbers for that are pathetic for recovery. But there's a detox component that's very important of every rehab. And being detoxed is super important, and you have to do it safely. So for addiction, it's an amazing tool. Ayahuasca is an amazing tool for it. And it's something that, to be honest, is a miracle for people.
Even if you're not addicted, when you finish off the week and like you're not even gonna crave a beer.
That's
Like,
right.
like people, like a lot of people that I follow up with, they're like they haven't drank any alcohol because of this like reboot of this tolerance.
Yes, it resets your tolerance to those substances, because drinking alcohol, your body doesn't have an alcohol gene. It doesn't have a gene that says I'm going to be an alcoholic because my parents were. But what it does have is a low dopamine genetic component, possibly. And when you drink alcohol, it surges dopamine, and that's the genetic component, is often a dopamine deficiency. So that's why people say like, "Oh, I inherited alcoholism from my family." You didn't inherit alcoholism. You inherited low dopamine and a behavioral observation that to deal with stress and anxiety and depression, your family drank. And so you realize that when they drink, they're happy. And you saw that. So now you're doing it. And so it's a behavioral thing combined with a neurochemical issue. And that's why ayahuasca works amazing for that. The thing I always say about addiction in particular is it's a two-pronged approach at helping people. In my field back in LA, before all this, the psychologists were always battling the medical doctors on addiction. The psychologists say it's history, it's trauma, it's emotion. We need to work on the trauma. And the doctors are saying, don't go there. You'll just trigger them. Give them meds. Keep them symptomology. Don't worry about that. And so they always fought each other, those two groups, schools of thought. But ayahuasca is amazing because it addresses both of those issues. It addresses the neurochemical deficiency. It recalibrates dopamine. And then it addresses the behavioral traumatic history that all addicts have some sort of version of, and it helps both of those things. So I am a huge fan of this for people in recovery or people that have some sobriety that want to just like never worry about it again.
Thank you, Dr. Jeff. So we have a handful of people now asking about how to book, how to get in touch with the guest consultants. Sylvia, right now, you're the host, so Cindy and I aren't able to put the link in the chat. So if you could just put, like make Cindy the host so that Cindy can put the link in the chat so that people can click there to book. Also, or to book a consultation with a guest consultant. Even without that, everyone on this call can go to rythmia.com, go to our website, and they can book, click on the book now button to then, fill out a form, and that will, put you in our system, and you'll receive a call and some emails from our guest consultant team. And then you can also call the phone number on our website during any of the business hours. So you don't need to wait for us to give you the link for that. You can definitely go to that yourself, but we'll be putting that in the chat shortly. So next question, on anxiety. We have a lot of people asking about if this works just as well for anxiety as it would for depression or addictions. Can you touch on that?
It absolutely does. And I've been studying all of the new research that's coming out, and I'm always on top of the new research on ayahuasca, and it's very good for anxiety as well. So the main mental health issues that the research is showing for ayahuasca is addiction. It helps remedy addiction symptoms, depression, anxiety, trauma, and PTS. I call it PTS. I like to remove the D because I don't believe trauma is a disorder. I believe it's a condition. And then eating disorders and personality disorders. It works very well for all those things, and anxiety is included in there. It's great for anxiety. It really helps buffer those psychosomatic symptoms, but also the neurochemical side of anxiety as well.
Okay, thank you very much. So we have people asking about the experience while they're on the medicine. So I'm going to throw out a few. Do I get dizzy? Do I feel anxious? Do I feel scared? Can you overdose on ayahuasca? So with kind of questions like this, it sounds like people have different fears around something that could happen while on the medicine. So could you address that generally and then also follow up on?
I want to say one thing about the overdose on it, then I'll turn it over to you, the rest of that question. So
Great.
we can all agree that probably one aspirin, baby aspirin, is good for people that have a heart condition to thin their blood and keep them from having heart attacks, right? But if that person takes 1,000 aspirins, it's not good for them. That's an overdose. So every substance is that way. So ayahuasca at the right dose, which is a very large amount, which we don't give you, is safe for most people. Can you overdose on it? You can overdose on anything, but we're not in that zone, not even close. And I've never seen anybody be able to drink enough ayahuasca that they overdose. I've never even heard of such a thing. So is it possible? Of course, like anything is, but that's not something that has to be worried about if you're medically appropriate to drink the ayahuasca. You have to remember, DMT is already in your body. You have DMT in you already. DMT is released into your bloodstream when you're born. I have a newborn baby. She's 5.5 months. She had a lot of DMT when she was born, released into her body, like we all did. And when people die, DMT is released into the body as well. It helps with it's transitionary from phase to phase in life. When you have lucid dreams, DMT is released. There's certain other events when DMT naturally in your body is released. So it's really hard to overdose on ayahuasca. Is it possible? Anything's possible, but it's not a concern that you would have to worry about at Rythmia. So I want to say that aside from the other question. Yeah.
So when you drink ayahuasca, there's like the physical or like the medical component of the psychedelic itself, the beta carbolines, that they can raise your blood pressure or your heart rate, or that you can have the visuals, like all this psychedelic experience. That there's that part of it, but also there's like the spiritual part of it that comes with the purging. So you can have different kinds of purges of how, like we already talked about, the vomiting, going to the bathroom, shaking, yawning. Also, you can have these downloads of information that we call consultas. Some people have something called nadas or nothing, that they fall asleep. It's not that common, but usually in the Colombian tradition, they say that usually when people have these experiences of falling asleep, it's because still the work is being done. You're working through your lineage, you're working through your traumas, brain synaptic plasticity is still happening, but the medicine puts you to sleep to work on you, right? Yeah, people can feel scared, people can have a little anxiety, because at the end it's like all of these emotions that are coming up, they're coming up for a reason. And ayahuasca works a lot with losing control. And sometimes, well, we as humans, we tend to love control, and so we love to be in control of our good emotions or high vibration emotions. I like to feel happy, I like to feel joy, I like to have control over that. But then when sadness or fear starts coming up and surfacing, we start to compress even our bodies. Maybe we start like changing our breathing pattern, and so now I'm like hyperventilating. That's bringing a little anxiety to it. Like that can happen, and that's just a reaction of your body to the medicine. But again, like having tools like the breathing, like something that's really important that we really like to engrave people when they come here, it's like to ask for help. A lot of us, when we drink medicine or during our lives, we're not used to asking for help. And so we try to manage it, and it all comes back to control, because I think I can control this, I don't need any help on this. And at the end, ayahuasca works a lot on that, on just losing this control. And so maybe it's going to put you in a moment where you feel uncomfortable, and that's okay as well. But it's also very important to know that you can ask for help. The helpers here are going to come, are going to help them out. They have been in hundreds of ceremonies already, with a lot of people navigating their process with them. And sometimes it's just knowing that someone can come, even, right? Maybe at that point you feel that you're alone and that you're gonna have a heart attack. I don't know, because our mind can go to very scary places, right? But just raising your hand, someone coming in, that just gives you a peace of mind of it. And then also, like, if you feel that there's something medically wrong happening, that's the cool thing about Rythmia, that there's a paramedic that can come, take your vital signs, address it. Even, if they have to call the doctor to come in, he will come in. It's like, it's all about the safety around it. So yeah, you can have some challenging, moments, because this healing is not easy. If it were easy, everyone would just, be healed like this. But it's work to it, you know. But the important thing is knowing that, first of all, what's coming is going, so nothing will last forever. And also that whatever is coming up is for you to, it's for you to leave your body, or to, just release it.
There's also a very high ratio of staff to guests. It's always 6 to 1, but sometimes it's 4 to 1. And that's how many staff to guests that we have. So there's a lot of people up in the ayahuasca sessions there to help. And you get to know them, you feel comfortable with them. They're using their shamanic practices to help. They're saging and using Palo Santo and Chandur and all these different really cool things that I've learned about. As the chief medical person here, I've learned that the shamanic tools are these amazing cultural events and experiences that help people stay grounded. And if somebody feels scared or out of control, like Dr. Mariana says, they will come and they will attend to you and be available. So it's a really beautiful experience, to be honest. Watching it unfold almost every night here for the last 9 years has just been this incredible, I can't even describe it with words, what I've witnessed in the healing of these guests that have come through here.
Also, I think something very important is that everyone has a different experience. Sometimes we tend to, like, compare ourselves to others, and because this person had this experience, maybe this can happen to me. No, it doesn't mean that. Ayahuasca, actually, it's one of the psychedelics that really you cannot tell what's gonna happen to you, So it's like every time, even every time that you drink, the first night to the second night to the third night, they're all gonna be completely different, because it'll take you where it has to take you at that moment. So also, that's something very important, that we don't have to compare to other people's journeys, because the medicine will take you where she wants to take you, and will bring up whatever it needs to bring up for you to go through that healing.
Hey, thank you. And a quick answer on this question. We have a handful of these that have come through the chat. How to prepare outside of just the dieta. So we already talked about the dieta, and there's details on that in the nutritional plan that Rythmia would suggest that you would do before coming to on site. But as far as mental preparedness, is there anything that someone has to do before committing to show up at Rythmia and then, booking and then arriving?
We've had everybody have different sort of protocols on getting here. Some people call and come the next day. Some people call and come in a month. Some come in a week. Some have lots of prep. Some have none. I think the most important thing to remember is, if you have the time, if you can prepare yourself emotionally and ground yourself and stay out of a negative headspace and not be in a dissociated place. And what I mean by that is unplugged from you, and you're living in like a monotonous sort of on autopilot mind frame. We all get in that position because we're busy working, trying to pay the bills. We got family to take care of, all this stuff, right? It's easy to be in that sort of just mindless rat race. So I think it's about, emotionally preparing yourself by just grounding and being calm and trying to avoid the outside distractions, not watching a bunch of TV or negative, dark, scary movies, things like that. I mean, just stuff that is not beneficial in an emotional way. You should just avoid.
Thank you. And as far as going with yourself or your partner, or like coming together, or arriving separately, right? What would you suggest on that?
So usually when we have people that come here together, even if they're partners, if they're brother and sister, or mom and daughter, it's really beautiful to see how they go through the process together. But our recommendation is usually to separate in ceremonies, in breath work, because when you go into ceremony and you're beside someone that you care for, sometimes, like, those feelings can start coming up. If your partner or your mom is having, a challenging moment, maybe crying, then you're already going into her or his process and staying out of yours. So our recommendation is usually to just sit separately so that you can really focus on yourself. Because if you're coming here, if you're doing this work, it's something that you're doing for yourself, not for someone else. So it's really important to always stay within.
And if someone is bipolar, actually, I'm going to group a few together here. There's questions on, is this safe for me and can it help on all of these difficulties? People that are bipolar, anorexic, PTSD, and complicated prolonged bereavement.
Bipolar is not recommended for ayahuasca, but the other ones are. So all the other things are okay as long as they're medically sound and medically cleared. Now, anorexia is very different than bulimia. Anorexia is extremely dangerous based on, because the person is not eating. And when people have bulimia, at least they're eating, so they're getting some nutrients, even if they're throwing it up quickly, they're still getting some nutrients. So anorexia is considered a little bit more serious. So as long as that person is medically cleared, doesn't have heart-related conditions, isn't in a state of distress with their liver or heart, and if they medically are appropriate in those ways, they can participate. So and then long stage bereavement is also a really great reason to try this program because it really helps get perspective on the sadness and it helps you process it. It's not about avoidance of emotion, it's about facing emotion. So all of those things would be good. It's just bipolar is not a recommended. We don't allow bipolar to participate.
Are there any other mental or emotional conditions that you would not allow participate in ayahuasca?
Schizophrenia is the other one. And all of the 10 personality disorders are good for ayahuasca. We don't make medical claims as a healthcare facility. It's not something we do. It's not appropriate. But what we can comment on is the reported experiences of guests that have come through here. And what personality disorders, the common ones: borderline personality disorder, obsessive compulsive personality disorder, dependent, avoidant, things like that. Those things, all histrionic, those are all really good for this program. The reason is because you move from an ego syntonic to an ego dystonic space, which means that instead of viewing the world in one way, that's your view, you understand that there's other people that have different views, and you learn that you can hold your own emotion. You don't have to project it onto other people for them to hold, and you don't have to target people for that. You can just deal with it yourself, and you build confidence within that. So that's why it's really good for personality disorders. It's really good for eating disorders if the people are medically sound. And it's great for all of the mental health conditions except for bipolar and schizophrenia.
And specifically on ADHD, we've had a lot of people on the call ask about ADHD and what ayahuasca can help them with.
Yeah, so that's another one that the guests report having much milder symptoms afterwards, and that it helps remedy that. And there's a lot of different reasons there's a lot of different theories on why people have ADHD. I won't get into all of what that is because some of them are controversial, but nonetheless, it's people that are unable to focus and are having a hard time being successful because they're jumping around, skipping around, can't concentrate. That is often based in childhood trauma or an inability to have needs met emotionally at a developmental age. There's all these different reasons behind why people have that condition. We don't view it as like something horrible to have. We just view it, okay, if it's hindering your success, it's something you can focus on and have an intention for when you come here. And we've had a lot of people with that, tons of people with that condition that report their symptoms are much milder afterwards.
Excellent. Now, I have a handful of questions that I'm going to combine into this. We have people asking generally about creativity, right? Some asking if ayahuasca can help them as an artist, as a musician, but also people who are commenting on how they feel stuck in work with their profession, with their career, with relationships. There's this feeling of creativity stuckness. Dr. Mariana, could you comment on how ayahuasca could help someone in that type of position?
Yeah, so I think in all the psychedelic realm, like creativity is something that comes up a lot, right? Because how we were talking about how sometimes we go through this, we're just living in this tunnel vision. And when we drink ayahuasca, this component of bigger awareness, like new perspectives, start coming into play. So yeah, I think it can help a lot with creativity. And also, one thing that ayahuasca does a lot is to connect like with your inner child, and this inner, like this childlike playfulness. When you're in ceremony, you can feel it. You can feel how everything starts becoming, you know, like if you were a child again, even the emotions start feeling bigger, like when you were a kid. And also, one of the things is that when you drink a psychedelic, there's been research about how your right brain, your right hemisphere of your brain is more active, right? It's coming into like that creative state, this part of like the sensations, this part of what a psychedelic, you know, realm starts opening up. So definitely creativity can start helping in, can start being better, or like it can help a little bit with creativity.
Yeah, a lot of the amazing art that comes out of ayahuasca participants is incredible. Because ayahuasca in particular is associated with a lot of art, you know, amazing paintings and just creativeness. Because you're accessing both hemispheres of your brain, the intellectual, logical side, the creative side, the artistic side, all of that's lining up. So people are definitely tapping into that, like through this system.
And a lot of the creativity also is connected with emotions. So when you're able to open up to all these emotions that maybe you have been storing, you know, this creative process can be enhanced also.
Sometimes people that are stuck in certain career paths, or they're in a job where they have to be creative and they've kind of like hit a wall, they come here and then break through that wall. So that's often an intention that we see quite a bit of, especially people in technology and, you know, and creativeness, like with all the stuff that's going on with AI and all these kind of stuff, that's a big part of like what a lot of people are here to do. It's kind of break through that, maybe that block that they have in their consciousness.
Okay, thank you. I want to dive right back into that. We just had a few people ask a very similar question in a row around heart health. So I'll throw a list of a few things that people are concerned about: obesity, blood pressure, arrhythmia, heart palpitations, and pacemaker issues.
We have to have your blood pressure before you drink ayahuasca has to be 145 over 85 or lower. Not too low, of course, right? But 145 over 85 is the limit. Now, there are some benign blood pressure medications that are quick acting that we can give you here on site if you need it, because a lot of people, you know, they're traveling from all over the world and they're nervous, and maybe they come from a cold climate and all of a sudden they're in Costa Rica and it's hot here and it's humid and they're not used to it. So sometimes their blood pressure is elevated. If they're on blood pressure medication, we go case by case, but generally you can stay on your blood pressure medication. Like if that's something you're prescribed naturally, usually that's not an issue. You can stay on that. Now, if you have an arrhythmia, you cannot participate in ayahuasca. It's dangerous. But as far as like other obesity, again, obesity has secondary symptoms such as heart conditions, thyroid conditions. There's often other med conditions involved. So we have to look at the whole person, but obesity, just as obesity, is not an issue with ayahuasca. Sometimes if someone is morbidly obese, what's their mobility like? Can they get up from their mattress to use the restroom easily? You know, and if not, it's okay, because there's a lot of staff here to help. So we make accommodations for people. We've had people that cannot hear. What's the politically correct word these days to say? Deaf. It's not deaf, I don't think, right? They can't hear. I don't know how you call that anymore.
Yeah.
But
In Spanish, it's called hipoacusia.
okay.
Sometimes it's hard to translate.
Yeah. So forgive me, I'm not up on my latest terminology, but we make accommodations for people based on where they are in their health related issues. And if they meet the medical standards, then they're fine to come here.
And is there an age limit?
18 and up.
So the question that I had in mind,
By the way,
that
chat,
was,
we've had a 96-year-old woman here who did awesome.
Yeah.
well, on that, in my first time, there was an ancient, I don't know how old, but ancient, needed support to get up, to move, to go to the bathroom.
Yeah,
It was really sweet to see the medicine team just rally around and make sure that they got to go where they needed. So
yeah,
yeah.
It's never too late to drink ayahuasca.
that's for sure.
There are a handful of questions that are kind of similar all along this line of the problem being that I don't feel like I can trust myself. I don't feel like I can trust my brain. I don't feel like I can trust my own intuition. Can ayahuasca help someone to gain clarity on who they are? I think is the question that people are asking.
Well, yeah, I mean, ayahuasca builds confidence because you find and really achieve the realization of your true self. Because we believe that between the ages of 2 and 7 years old, all of us dissociate. And what does that mean? It means that we unplug from our true self because we see and we believe at that young age that it's not safe to be really us. And maybe we're not getting the attention we need. Maybe we're feeling abused or neglected or abandoned or something. And so we start showing the world something that's really not us. And that persona that we show the world that's not our true self takes on a life of its own, and eventually we're not kids anymore, and we're who we are, and so we don't even know who we really are. We're unplugged from ourselves, and this process and the intentions we teach help you connect with yourself, and that's where you build confidence in you, because you really now are grounded in who you are as a person. And these three intentions are: show me who I've become. That's the first intention. So that's the dissociative part. Like, what are you showing the world that's not really authentically you? Number two, merge me back with my soul at all costs. That's where I come back to myself and I'm connected. I'm no longer dissociated. And the third intention is heal my heart. So that's get rid of all the trauma, all the emotional pain, all the neglect, abuse, abandonment, whatever, all that pain leaves. And that's our process. And in that process comes that realization about who you really are. And the trust comes in your true self. You know who you are, you just forgot. And so it'll come back to you through this ayahuasca session.
This lack of trust basically is just being disconnected from yourself. And like as Dr. Jeff was saying, like merging back with your soul, merging back with yourself, that is regaining that trust and that confidence.
Thank you. And we've had questions coming through wanting to compare ayahuasca to every psychedelic in the book. Iboga, ketamine, psilocybin, MDMA. Questions have been coming in on all of those. Can you give us an overview of the difference in how ayahuasca functions in the brain compared to different psychedelics?
A lot of the psychedelics are serotonin agonists, which mean they create a serotonin response. A lot of them have that in common. But because they're all different substances, they do it a little differently. And the uniqueness of ayahuasca is that it has that monoamine oxidase inhibitor component, which allows for the absorption of that DMT molecule into different cellular organelles of the body and cellular systems and crosses the blood-brain barrier. I think if people were to compare like psilocybin and ketamine, and it's kind of in that realm of like experience, but it's its own unique thing because it's like drinking a cup of nature is what the shamans say. So what is nature? Well, nature is orderly. Nature is all around. Nature is nurturing. Nature is direct and sometimes harsh, but it's a part of who we are as people, and we've lost connection with that. And that's why the indigenous groups in the world are more connected to nature because they're closer to it in their cultural practices. So I think that, you know, if you compare it to, it's hard to compare it to any other psychedelic, especially the synthetic ones like LSD and ketamine. But I would say like it's probably mostly close to psilocybin, but it's not the same because psilocybin is more about it's more about like acceptance of what is and maybe realization of what is, whereas ayahuasca is the understanding of self and like paths and downloads of information that you need to move forward. So it's different in that way, you know, but everybody's experiences are a little bit different, but that's how I would categorize it.
Yeah, and in a bigger sense, also the difference in how they serve it, right? The tradition that they come through. In this case, we work a lot with the Colombian tradition, so the way that they guide the medicine is completely different from other traditions, from iboga, even psilocybin, and that brings definitely a different component into the medicine.
Yeah, the
Into
Iboga, the African shamans with Iboga in Gabon and Cameroon and the Congo, they have a different approach that's more like they call it the stern grandfather. It's more directive and it's really amazing too, but it's just a different sort of purpose. Ayahuasca has more of a feminine maternal energy to it, and it's kind of a little bit more nurturing in that sense. So I think it's, again, it's just depends on everybody's own experience and the tradition that's involved with the serving of it, like Dr. Mariana said.
Hmm. And what about physical healing properties? Does ayahuasca have any physical healing properties?
Oh, it's really good for autoimmune disorders. That's what people are reporting, and that's the research is showing. Lupus, rheumatoid arthritis, Lyme's disease, all kinds of autoimmune situations are remedied. What the guests report to us and what we're seeing in the literature out there. It also helps with tinnitus for some people. There's a lot of like medical things that can happen. Certain guests report that they had like early stage cancer and breast cancer and prostate cancer, and then that was gone. And we're not saying we're not claiming we cure that. We're just saying, I'm just commenting on what guests have told us, and what the research has shown. There's a really good article that shows that a professor at a major university healed prostate cancer, he believes, through ayahuasca. So there's all the, ayahuasca is antibacterial, antifungal, and antiviral. It's also anti-inflammatory. So it's a very detoxifying, healing process. And the curanderos of Latin America have used this for thousands of years to keep their tribes and their people in a healthy state. So there's a lot of history behind this. In the Western world, we've lost track of our indigenous roots. And so this is nothing new. This is something that's been around for thousands of years. And the West is just now starting to kind of look at it and see the benefits of it for physical ailments as well.
And also, so many physical illnesses are because we have so many trapped emotions. So, of what we have been on the same line, just releasing and going through all these emotions and releasing all that trauma, that can be also something, that helps with the physical symptoms.
Definitely. The anxiety in the Amazon is a little different than the anxiety of somebody in Midtown Manhattan, right? I mean, they still have anxiety in the Amazon, but it's a little different, and it's looked at differently and it's framed differently, So there's a lot of that groundedness that you get through participating in the ayahuasca sessions.
So a question getting back to depression, right, which was the title for this webinar, and we're grateful for all the questions, but I want to focus on this one because I think this is why a lot of people are here. What percentage of people with mild to moderate depression are able to resolve and sustain it with ayahuasca?
The latest studies that I looked at say 15% of people report having absolutely no symptoms afterwards. 60% report having still a couple moderate symptoms, and then like 3 or 4% report that it's still the same, nothing's changed. So that I'm just trying, and I'm not exactly accurate 100% on those numbers, but that's the latest. I was doing a presentation on depression to some people, and that's what I'm remembering. So because it is different between moderate, mild, and severe, and the numbers are worth using this modality to help the depression. It's very rare that people have no response at all to the depression, and it just stays, especially if it's your intention. So that's the thing that's important to remember, is that the mindful intention setting that accompanies the ayahuasca is just as important as drinking the ayahuasca. You have to be focused on what you're trying to heal, because our mind is a powerful tool to help our body get on board with what we want to have happen. And that's something that we teach you when you're here at our program.
Thank you. We have a lot of people asking a similar question, but with a different flavor on it. Basically asking how inclusive of a space is Rythmia, with questions from religious preference, sexual orientation, gender identity. Can you touch on the Rythmia philosophy on inclusivity?
You want me to do that?
Yeah.
Okay, good. Yes, great question. So we're non-denominational. We have people with religious and spiritual and non-spiritual beliefs from all over the world. We've had every group represented here. We respect and honor everyone's tradition, identity, and affiliation with any group or who they are as people. We've had transgender clients. We've had everybody that identifies in any way that they feel is them. We've had them here. We respect that. We honor it. We welcome it. We've had LGBTQ plus weeks at Rythmia. We've had women's weeks. We've had a whole lot of production and promotion and outreach to different communities in the world to come to Rythmia. We have a scholarship program for people that can't afford this. Our goal is to have 25% of our guests every week be on scholarship. Every week we have a couple, but our goal is to have 25%. So that's possible if you can't afford it. You can look at our website and find out how to apply for a scholarship. And I find it to be an amazing place for everybody to feel safe and attended to and to feel respected. So that's a big deal for us, because we have a very diverse staff, and the diversity of the staff is reflected in the diversity of the guests.
Okay, now a few questions for in ceremony. We have questions on how to have a good experience, generally is the overview, but specifically on staying hydrated, staying centered, having intentions. Should you have more than one intention? Should you focus on the Rythmia intentions? Could you give us an overview of how people can go into an ayahuasca ceremony kind of arming themselves mentally, spiritually, physically, so that they have the best chance of a transformative experience?
Well, I think that there's no like perfect equation that you can do to have like a good experience, because you're gonna have what you're gonna have. But things like hydration, since the first moment that you arrived here, the medical team gives you some electrolytes to keep on hydrating throughout the day, even before ceremony. The paramedic has the hydration, also electrolytes with him in case that someone feels like a little dehydrated. As for intentions, we recommend to stick with the three intentions that we have here. A lot of people that come have a lot of intentions and a lot of questions around everything. But we've seen that using these three intentions usually meet every other intention, because at the end those are the core of what people are looking for, like show me who I have become, like all these things, that this emotional baggage that I have, what I present to the world, merge me back with my soul, coming back to myself. At the end, that's the healing that everyone in the end wants to do, to come back to themselves, to merge and to heal their hearts. So as for intentions, we do recommend to stick to the program, use those intentions, and when they have gone through these three main intentions, we usually also offer some other intentions, or that's the moment where they can start getting creative, a little bit of what's next, like forgiving the unforgivable, or any specific questions. We see a lot of that in breathwork the last night, that a lot of people have gone mostly through all the intentions, and in breathwork it's a moment where they can set this specific question if it hasn't been met during the three intentions.
Okay, thank you. And we have a handful of safety-based questions here. Have there ever been allergic reactions to ayahuasca? And I'm going to throw this one too, because I think it's important to cover. Should someone do psilocybin within a few weeks before or after?
We've never seen an allergic reaction to ayahuasca in our history of patient history. So I'm sure some people would be, but the dose that we start off everyone with is so low that if you do have an allergic reaction, we're equipped to handle it. And we're not giving you a giant glass of ayahuasca. We're giving you about maybe an ounce or a half ounce to start. And so we ease you into the medicine experience. So it's nothing to worry about there, but if you do have allergic reaction, we're equipped to handle it. And what was the other question? The other part was about
Psilocybin.
oh yeah, psilocybin. So 30 days prior to ayahuasca, you should be not taking psilocybin, 30 days before and after. And the reason for that, and a lot of people mix the two out in the world. They'll take the chocolates that have ayahuasca and psilocybin in it. It's not recommended. It's dangerous. It can be dangerous for people. So we say 30 days off of psilocybin prior to ayahuasca and 30 days after. If you're going to have a journey with psilocybin, it's a ceremonial experience, wait 9 weeks post ayahuasca, because you want the ayahuasca effects to settle in and to have your full experience. But if you're using it as a microdose for depression or other things, you can go back on it, but you have to wait 30 days.
Thank you. And has someone's depression ever gotten worse after ayahuasca?
Some people say that it has, but that's rare. And it's because they're still in their process. So what we teach people at Rythmia is that like you heal and then you employ what you've learned. And that's an up and down process of increasing improvement. So some people might feel for a little while, a few days, especially the 2 weeks right after, that they're kind of like are in a little bit of a slump. Well, that's because you're adjusting to the new you. So some people might say, well, yeah, I feel worse or something, but it's maybe because they just went right back to their old ways and they've seen that there's a new way that they are and a new way to be, and they really know who they are. And then they just fall back into old patterns, and that can be depressing. That can be upsetting.
Mm-hmm. In the ayahuasca ceremonies, what happens when people feel anxious or scared? Is there support there for them to be supported through that experience?
Yeah, definitely. Well, the first thing, as I said earlier, like we teach guests to use their breath. That's gonna be the number one tool. It's gonna help them through this anxiety symptoms. But also, if at any moment this happens, we encourage guests to ask for help, and any helper, the shamans, whatever, whoever is around, is gonna come and assist you.
All the modalities we offer at Rythmia are connected to how to have success in the ayahuasca sessions. So just like Mariana said, the breath work, the yoga, the way we do yoga, it's all supporting the ayahuasca experience, the classes, everything. So it's not like you're just here like, oh, I'm just drinking ayahuasca, see what happens. It's not like that. We have a program that's very specifically laid out to help you have the most success.
Now, we have a few questions here along group size. Can you help us understand what type of size is best? I remember Taita saying something about the energy in the room.
Yeah, it's like that's a counterintuitive realization that we've made, is that the larger the group, the more successful the outcome in our week. And what that was very shocking to me was that I thought, well, if there's 15 people in a ceremony, that's going to be better because there's more attention and more focus. It's not the case. The smaller the group, the less successful the outcome. So why is that, right? Well, what we've come to understand is that the energy of the group, when it's bigger, is stronger and there's more momentum as a group. And sometimes people have a reason that they can't drink ayahuasca one of the nights. It's rare, it happens, but we still encourage them to go up there and participate in the session, not drinking ayahuasca, but being there, because their energy is part of the group and it's momentum. So we can hold 100 people here at Rythmia every week. And before COVID, we were sold out for months in advance, and we're getting back to that space lately. So when there's a full group here, it's amazing. It's so much fun. It's amazing, healing and powerful, amazing connections. But the larger now that's counterintuitive to the world. Most of the world have 10 people, 15 people, 8 people. And people think that what we're doing at Rythmia is not appropriate. They have no idea because they've never done it. And we've done it for years. When we first opened, we didn't have 100 people in a ceremony. We had 12 for a long time. We had small groups as we built momentum as a company. So we have a lot of data that we're comparing this to. The early days of Rythmia, the success rate was lower. Now we have the program fine-tuned. We have a lot of people in the ceremonies, but there's a lot of staff and the momentum is powerful. So I like a large group, and that's what the data shows is most successful.
Well, since we're on that topic, let's also dive into the miracle rate a little bit because that's how we're judging, right? Success. Can you explain what a miracle means at Rythmia, how participants and guests at Rythmia receive miracles, and why we're so confident in that data?
Well, the miracle is something that we use here to just evaluate, like, if people have a life-changing experience. Some people, and there's not a specific way a miracle can look. For everyone, it's gonna be different, and it's about the feeling. Usually, when people say that they have a miracle, it's because they have gone through the three intentions. The three intentions have been met, and the miracle can be this, but also can be a change in perspective. It can be a realization. A miracle is a life-changing situation. And right now, we have a 98% miracle rate in the past 6 months, right? Yeah.
Yeah.
So 98% of the people that have come and done the week, they have reported that they have received a life-changing experience, that it's a miracle. And it doesn't have to be one miracle. People report having a lot of miracles, because it's these different feelings that they get, and it can be during ceremony, it can be during yoga, it can be during breath work, it can be even having lunch. So yeah.
Yeah, and the soul merger component of our intention setting is kind of what we like stamp as the miracle, like on the exit survey. So if somebody goes through the program and hits all those three intentions and they have the soul merger and they got the healing they came for, then that's the miracle that they check on the box at the end. And so to us, that means that they've realized why they're here, and they've had, like Dr. Mariana said, all of these breakthroughs in different areas of their life. They're light workers and light warriors, and this is a place to come to establish that identity and move forward in life, helping other people around them achieve the same vibrational frequency that's very high for healing.
So here's a question, actually, two. We have people questioning and wondering how ayahuasca and the functionally changing the brain, if it's similar to neural feedback or cognitive behavioral therapy.
Absolutely. All of those things are involved in the same sort of neuron pathway shifts that occur by realization, new patterns of habits and things, and changes in ways of thinking. So all of that's related. It just depends on what way can be more effective and quicker. And cognitive behavioral therapy does the same thing as ayahuasca, except because of the DMT component and the monoamine oxidase inhibitor component, it's faster with the ayahuasca than it would be in therapy doing CBT exercises. But it is the same exact mechanism. It's mindfulness. It's the ability to say, okay, well, if I feel triggered to drink alcohol and I have an alcohol abuse issue, I'm not going to the bar to listen to the music. I'm going to stay away from there. I made a choice. Then I have a new way of doing it. I have success. I feel better. So all of that is related to a neuron pathway shift. And so the ayahuasca does the same thing, but it's in a different mechanism based on the substance that you're consuming into your body to help this process access your amygdala.
So what about some people who drink the medicine? We have a few people who have commented with this experience. I've drank twice in the United States and have had no psychedelic experience, or I didn't have any visions. Did it still work?
Well, it depends on, right? It depends on that medicine.
Yeah.
We can't comment on what that was. It might have been mud water.
I guess the real question is, do you need to have visions in order for ayahuasca to work? I
I
think.
think that's something very common that people tend to, get attached to, that if they didn't have visions, that the ayahuasca didn't work, or maybe I'm doing it wrong, and that's completely untrue. Again, the medicine is gonna work different in everybody, and yeah, there's the psychedelic component to it, the DMT, and some people can have visions, but ayahuasca is not about the visions. It's about the whole process. Some people say that they maybe are not feeling the medicine because they're not seeing jaguars or snakes, but they're purging, they're feeling, they're releasing all of these emotions, and that's the part of it. At the end, If you want a psychedelic experience, then maybe you could choose another psychedelic, maybe LSD for visuals, or but ayahuasca, it's different. It's completely targeting the whole thing, not only the visuals.
I think the example I give, and forgive me because I'm kind of juvenile, the example I give is that at a busy intersection at Midtown Manhattan, I used to live in New York, and the busy intersection, if there's a car accident, and it's a very dramatic car accident, and the police come and ask all the people that saw what happened, they ask them what happened, they're going to get 100 different versions of the story. That guy ran the red light. No, that guy did. No, they're going to get all these different versions visually about what happened. But if they ask all those same people how they felt, they're all going to say the same thing: worried, scared, right? The real healing is in the emotional process, not in the visual. Visual is just a side thing for some. It can be helpful a bit, but it's not really what it's about. It's about the emotional release and the emotional connection.
Hey, thank you. Now we're going on 2 hours and we still have a lot of people in the room. Thank you for staying with us. We have about another page of questions that we'll still go through, but please feel free to continue asking questions if there's something still on your mind. Anything specifically about booking, please just schedule a consultation with someone in the link that we've put in the chat. We'll also put a phone number in the chat here in a minute with a promo code to get a discount on booking for anyone that hasn't booked their trip yet, and we'll send out the terms and conditions with all the different stipulations tomorrow in an email. But please call when you schedule the consultation and get on the call with one of the guest consultants, or when you call our number, please use this promo code so that they know that you attended this webinar. That will probably help their conversation with you a little bit as well. We'll have that in the chat here in a minute. So moving forward in the questions, how can ayahuasca help you process guilt?
Well, forgiveness of self is one thing that we teach people here. And having forgiveness for yourself is very important, because if you're holding on to guilt and shame, then you're holding yourself back. So we all make mistakes. It's all part of life. But forgiving the unforgivable is the intention that we talk about. It's just about you forgiving yourself. So it's very good at that. It's one of the main intentions I teach the alumni. When alumni come back to Rythmia, their second, third, fourth, whatever time, I give them new intentions to work on, and that's one of them, because it's a very important one. So that's a good thing that you can work on here, definitely.
And does ayahuasca have any effect on migraine headaches? And is that something that for someone that has migraines that they should be concerned about?
Well, depends on where the migraines are coming from. It can help if it's migraines that come from, emotional storage, definitely can help.
There's a new migraine medication out on the market, a couple years old, that's a DMT analog, meaning that it becomes DMT in the body when they consume it, and it helps with migraines. So DMT itself is helpful for some people, they report, for migraines.
So we also have people asking about insomnia. Is there any literature on ayahuasca and insomnia?
There is some literature on Rythmia, or not Rythmia, but on insomnia and ayahuasca. There is, and a lot of that is an anxiety related issue, or a sleep rhythm, obviously, issue. And a lot of that stuff gets calibrated. Again, it's in that part where I was discussing how we're in certain routines, certain negative behavior patterns, certain negative thinking, and all this has been established over our life in our brain, and it's all kind of jumbled up. And insomnia is one of those things that's related to that. So when you reset your neurochemistry, reset your circadian rhythm, reset all this stuff, heal trauma, heal anxiety, process depression. Usually people report having the best sleep of their lives while they're here. Usually Friday night is like they're just crashed out because they've been through a lot through the week, and it's a good indicator that their insomnia is being remedied.
Yeah, I've had some people that I usually follow up with some people, and I've had quite a couple of people that have told me that that's one of the things that has helped them a lot, like in their insomnia, that they are not taking medication and that they're sleeping like a baby.
Wow. Yeah. Awesome.
Wow. Can you talk about the different levels of consciousness that people could experience while they're in ceremony? Everything like from sobriety to full-on visions.
Well, I think it just depends on the person, you know? Like I've had nights where I'm just lucid the whole time and maybe fall asleep a little bit, all the way to having um patterns and sacred geometry, they call it, and just different kaleidoscope colors, all the way to having conversations with ancestors and relatives and friends and just, you know, you name it, like talking to plants, all kinds of stuff, but also just like really, really simple things of just clarity and getting downloads and awarenesses about my life. The reason I have a fifth baby is because I asked in a session if I should or not, because I was unsure. I didn't know what to do. I got 4 kids, so I have a fifth. The answer was very clear, yes. So I did, and I have this beautiful new baby, 6 months old. And so you can get some information for your life if you're seeking that. It just, again, I think everybody's experience is really different, you know, just depends on the person.
Always is. It's different for everybody.
Yeah.
Hmm. And how does the medicine team keep the ceremonial space safe in such an open and receptive, energetic environment?
They all had to train really hard. They're all very skilled. They're not just walking in there and trying to, you know, serve ayahuasca. They all had to go through a rigorous training protocol. There's shamanic practices, there's cultural practices, there's rules and regulations that we have as a company. There's a perimeter that people cannot leave if they've drank ayahuasca. We're monitoring the area. The shamans themselves are using copal and they're saging and they're doing all kinds of, they're doing icaros chants and prayers, and they're spiritually protecting the whole area. That's not an area that's my expertise, but I've learned from the shamans, like it's a very important part of this whole thing is, and like Dr. Mariana said earlier, the set and the setting are very important for this to occur. Because if you just went to a doctor's office, you know, with bright lights and drink ayahuasca, things would happen probably, but not a lot.
Yeah.
I think it's more profound when you're in the cultural environment where all of this is happening, where they're protecting the space, and you know, the people that have a high level of integrity. If they don't, I fire them, which I've done before, but it's not very, right now we have an awesome team and we have a great set of shamanic people that are in there, and they're always learning and growing and being trained by our main taitas that we work with.
So we have people asking, or maybe just one person over and over asking about fibromyalgia. Do we have any data on that?
No data on fibromyalgia other than people that have had it say that their symptoms are reduced. We don't have any like specific data on that. That often is a psychosomatic component. All health issues are, not to say that it's 100% that, it's not. There's biological reasons, but fibromyalgia is definitely helped by releasing stress. Absolutely. And just like I have a good friend of mine that was recently diagnosed with lupus, and there was a lot of it was stress related. And so when he healed the stress part, his symptoms dramatically reduced. So all those kinds of things can be helped, you know, that we've seen from people reporting that as alumni.
And we've had a few follow-up questions on mental health issues since you gave the, some blanket statements earlier. What about people who have bipolar or schizophrenic in their family, but they're not diagnosed with it?
That's good. So we go case by case. Usually schizophrenia follows the maternal line through the men. There's exceptions, of course. Some people are genetically predisposed to schizophrenia. They can have a psychotic break. We go case by case and look at your family lineage. We also evaluate how you're doing in your life, what age you are, because usually the schizophrenia thing will happen like in your early 30s, for depending on male or female. And if you're meeting criteria, then it's safe for you, but we're not pushing it on you. So if you feel that you have a family history, you have immediate relatives that have schizophrenia, you have some early warning signs of schizophrenia, which there are some that exist, we evaluate you before you book. We make sure that you're safe to do it. So that, if that's in your family history, we definitely look at that. We want to make sure that you're safe to do this.
Are there any reasons that people would need to stop taking hormone replacement therapy for thyroid or other issues?
Not really.
Nope. Those aren't contraindicated.
No?
No.
We have a few medical professionals, it seems, that are on the call asking questions about how to incorporate plant medicine into their American practice.
Ah,
Mm.
nice. Well, because it's a Schedule I substance and it's banned in the United States and other parts of the world, you cannot officially refer anyone to go drink ayahuasca. You can't advocate for it, but what you're probably seeing in your practice is that people, your patients, are coming back from places that they've drank ayahuasca and they're either better or they need integration. So I think the way to incorporate that into your practice is to receive some pretty basic training on how to help people do integration. And Rythmia is working on right now an integration package for healthcare professionals to help them use the tools that they already have as therapists or doctors to help people transition back home in a smooth way. So I would say, you know, the way you can look at it now in the meantime is that if you have a person that recently was in ayahuasca ceremonies or any psychedelic ceremonies, you just treat them as, you know, people that have overcome trauma or people that are trying to understand how to develop new tools to deal with their anxiety or whatever it is they might be dealing with. And there isn't like a new way or a sort of a special way to treat the patients. It's just a matter of just client-centered approach and just helping them get their bearings, because they, you know, they've been carrying around a backpack full of rocks for probably decades, and now that backpack is gone and they feel a little unbalanced. So it's a matter of just helping them ground themselves, use the tools. We give people, like Dr. Mariana said, an Our Life, it's called, app that people can use for integration. We're going to be having that available probably to the general public in the future. We'll see. And that's going to help healthcare professionals like integrate this into their practice. But it's a huge field that's emerging right now. So I would suggest that any healthcare professional that has questions about it should come to Rythmia and go through the program themselves and see what it's like. Every week we have medical doctors, psychologists, we have social workers this week that are here. We have all different clinicians, nurse practitioners, RNs, everybody comes and they go through the process themselves and they see how to work with their own clients. It's really cool.
And Dr. Mariana, can you touch on how important integration is after an ayahuasca experience, and then how to solidify the miracle that guests are experiencing? There's some fear in the chat that after, you know, you'd have an incredible experience on ayahuasca, that within time you just go back into your same old life.
Yeah, integration definitely, it's a big part of drinking ayahuasca. That's why we have developed this new app for everyone, because we've seen that people really need to remember what they have gone through. So all the way from having meditation or yoga, just having a daily practice, that it's super important, because that is going to help you be centered at the end. It's challenging when you have a very busy life, and yeah, we can go to old patterns, but when you have these modalities, or when you have just something as a daily practice that can help you to come back to yourself. Also, if like your daily practice, I don't know, is walking your dog or meditation, then you can have aside other tools, like for example breathwork is a really good tool to use when you're integrating. If you don't use it as a daily practice, you can use it just as a tool to just come back to yourself, to because in breathwork you can set an intention when you're, and you can do the breathwork that we teach here at Rythmia, one of those. It's really easy, and you can do it for 5 minutes, 10 minutes, 30 minutes. It's all about playing your favorite playlist that we also share in the integration app, and just start breathing. And if there's something that you know it's taking you off, if you need clarity from something, or if you feel that you're going into old patterns, you can always set that intention when you're going into these practices, and that can really help you, you know, come back to yourself.
Thank you. Thank you. So we have great news. We have gone longer than 2 hours, which is, and we still have a handful of questions to answer. The the great news is that we're all still here. The bad news is that some of our batteries on the cameras are winding down. So if we end up getting accidentally cut off, know that that's what happened. We didn't plan on going longer than 2 hours today, but we're grateful that we're all still here. So we'll keep going through questions. But if we get abruptly cut off before we finish all of them, that's why. So I'll remind everyone, if you are wanting to move forward and to learn more about ayahuasca, to see if this is the right thing for you, to see if the Rythmia Way program is the right program for you, please go up to that link that we shared in the chat around 7 o'clock. That's the link to schedule a consultation with one of the Rythmia guest consultants. I've seen a few messages in the Q&A come through that calendar has been booking quickly, and that people aren't even able to schedule in this next week. So if it's already booked up, you could also call in on the phone number that's in the chat. So make sure to take a look at that. If you miss both of those, please just go back to our website, click on the Book Now button, or call the phone number that you see in the banner. We have a full phone room and a team that is just here to help you answer your specific questions and to prepare for your experience with Rythmia. And at least everyone here on this call and the people in the phone room, everyone that you'll interact with, we're all here because we've done this, because we've gone through our own journeys of us finding the medicine mixed with the medicine finding us, and had miraculous experiences to the point that we've all committed and decided to commit ourselves to sharing medicine with people throughout the world. So even with people with skill sets like maybe mine that are outside of the traditional medicine team, we're all doing what we can to share ayahuasca and share the Rythmia program with other people, with our friends, family, and then all of you wonderful 140 people still here on the call, because we believe in this so much. So before going into the rest of the questions that we have time for, thank you for staying with us. We hope that this has been helpful. We hope that we've answered your questions and that we've helped you to feel a little more confident, a little more comfortable in moving forward with your own journey, whether that's with ayahuasca or maybe not. We want you to feel confident moving forward in whatever direction you're moving forward with in your process. If ayahuasca is calling to you now, if you feel that urge, that push to come experience this at Rythmia, then we hope that you do. And if you're not, then that's okay as well. And maybe this is something for the future. I knew about ayahuasca for about 4 or 5 years before I finally pulled the trigger and went to Rythmia for the first time. So there's definitely no hurry, but when you feel like it's time and you feel like it's ready, then we're here for you. So with that, I'll go back into the chat. If you have a super urgent question that you need answered, please put it back in the chat again, and to bump it up in the priority. So because I still have so many here that we're trying to get through. So let's see. Do you have to attend all of the classes? People that have maybe mobility difficulties or just don't like yoga?
There are mandatory classes and then optional classes. Now, mandatory is in quotes. I mean, nothing's mandatory, but we have shown that if you attend all of the mandatory classes, your chances of getting your miracle are significantly higher. So every time you miss a class that we consider mandatory, your percentage of getting your miracle drops about 28 points. So it's important to go to all the mandatory classes, and those are all accessible easily with people that have disabilities or in wheelchairs and all that. It's okay. But not everybody goes to yoga. Not everybody goes to a couple of other, like, informational classes and stuff, but everybody goes to the plant integration, and everybody goes to the class that I teach on Thursday morning, and everybody goes to the first class on Monday. So there's about 6 classes that we consider mandatory or very, very important. And the other ones are also important, but there's a little bit more flexibility there.
But if you're here and you're doing it and you don't have any disability, we always encourage you to go to every class that you can, because yeah, the answers, what you're looking for, clarity, it can be in any class.
Okay, thank you. And is there any consideration or difference in effect for postmenopausal or during menopausal women?
What was the question? Can you repeat it?
There is actually there. So is there any difference between postmenopausal and premenopausal women? Is there any difference in the effects?
In the effect,
Yeah.
yeah.
And so, you know, because like, I think I can comment on this, but I think Dr. Mariana should instead of me, unless you want me to. You want
Go
me
ahead,
to?
and
Okay,
I'll fill
I'll
out,
do
yeah.
it. The hormone-based menopausal situation in women that are going through those stages of life is a very powerful, ceremonial, respectful experience, and phase of life. And so the ayahuasca is a part of that cycle process in women. And what we've noticed is that if women are in the postmenopausal stages, and maybe they're in the early stages of it where their body's changing and there's a lot of symptoms that they're not used to yet and things that are maybe uncomfortable, we see that the ayahuasca helps with that transition in a really smooth way that's nice, and that the women report being grateful for. Also, women that have had struggles with maybe getting pregnant or wanting to be pregnant or different things like that, that they've become pregnant after an ayahuasca experience. And that, I think that has to do with kind of what we were talking about earlier, which is when you're holding on to anxiety, you're holding on to stress and depression and trauma, your whole body is in this sort of phase of shock and sort of survival. And if you're in a survival mode, you know, getting pregnant is not something that's probably recommended, right? Because you're probably running across the plains trying to escape something. That's like, you know, evolutionary wise. So when you release the stress, when you release the anxiety, when you release all the things, then your body is in harmony and things happen. And not to say that you'll get pregnant if you come here, but it's not that, but to say that your body is in line with itself. And so all the phases of womanhood are transitioning in a way that's beautiful, that's part of the moon cycle, that's part of the way the medicine's working. And women really connect with the medicine, I think, in a deep way that's beautiful. And the women shamans and the women medicine team that we have, and the men too, but the women are like where it's at. Like they're really incredible, and the men are too, but you know, it's the medicine is matching the vibe of the women. And so what I noticed with the premenopausal and the postmenopausal is that whatever symptoms might have been sort of hard in there or problematic, they're lightened a little bit, and they're smoother, is I guess the best way to say it.
Okay, thank you. And even though this doesn't connect with ayahuasca, but for people that have schizophrenia or bipolar, are there any types of programs or practices, therapies that would be similar to this that they could look into?
Yeah, ketamine for the bipolar people. Ketamine.
Mhm. Thank you.
Because you need to stay on your meds with ketamine if you're on meds, and usually people with bipolar are on meds, and those meds are often okay with ketamine. So of course you got to speak to your physician. It's a physician guided experience. I'm not talking about club drug ketamine. That's not what I'm talking about. I'm talking about legitimate legal ketamine IV infusions that are done in a therapeutic manner. And you have to consult with the physicians that do that. And then schizophrenia, that is the mental health sort of, I guess, difficulty of the 20th century. It's like, it's a hard one. You know, it's hard to have a person with schizophrenia in the family. No one knows how to handle it. The healthcare system doesn't know how to handle it. I like the indigenous model more than the Western model. The indigenous model is people with schizophrenia are the spiritual channels to the spirit world. I believe that. I used to work in the locked psychiatric hospitals in Los Angeles for many years, did my postdoc hours there. And the people that have schizophrenia are definitely spiritually deep. We have a system that doesn't match with them too well in the West. And so they get labeled as all these problematic things. And, you know, it is hard and it's a challenge, but the med protocols for people with schizophrenia are not good. Sometimes they are, but it's hard to, you know, you're trying to dull certain emotions, but in so doing, you elevate others, and it's a hard balance. It's a tough one. That's would be a life mission of mine if I could figure out how to handle that with people with schizophrenia. It's a tough one, you know. right now it's just med based, unfortunately, you know, that's all that we have out there, unless you go live in the jungle and deal with indigenous tribes, you know, which I wouldn't recommend either.
Hey, we have a few more that I think the menopausal question triggered these questions. Someone who feels very depressed when they're on their period, can ayahuasca help with that, or is it just genetic? And then does ayahuasca work for traumatic birth or postpartum?
Very well for all those conditions, according to the guests that have had those situations. Yes, like all the guests that have had those things, the very common stuff, have reported that their postpartum depression has been helped. Absolutely.
Also, women, like when they're in their period, there's a spiritual component, and how Dr. Jill was talking about how it's connected with the moon cycle and all of this. Actually, they call the Colombians, they say that when women are in their period, they're with their moon. And what they say is that it's like a type of like purge also. It's like that you're cleaning your body, but also it's the moment where the women is more connected to the earth. So it's like it's channeling that energy. So a lot of women that come here, they have a lot of clarity around that, because I think like women, we've had like a lot of trauma, generational trauma from our ancestors, just because of how, you know, all the repression, and we carry that even now in our blood, in our genes, right? And so sometimes we don't understand a little bit of where that's coming from, and ayahuasca is actually a very good source to go to those places to understand ancestral trauma. And I think that women, a lot of women start to understand, have a deeper meaning on like what the period is, what the moon is, the connection to the earth. So definitely can help.
Well, and Dr. Mariana, your explanation there, I think helped me to put a few different questions that people have asked tonight in a category. Can you touch on the divine feminine nature of ayahuasca
Mm-hmm.
and just explain like the what is Mother Ayahuasca? Why do people refer to it as Mother Ayahuasca? And how maybe that can help people connect with their own divine feminine inside of themselves.
Yeah, well, um, Mother Ayahuasca, it comes from what Dr. Jeff was saying on how like this medicine is so connected to the earth, to nature, and it has like this nature association to it. The way the medicine treats you, it's like it's holding you in her arms, and it's taking you to those places you have to see, but in a gentle way, for like a way to say it. It brings a lot that it connects a lot with that feminine side of it, like this nurturing, this loving energy, but also it's it's it has this energy, but it doesn't mean also that it represses the masculine energy. It gives a lot on balancing both energies. Actually, on Wednesday nights we call it Divine Feminine Night, and a lot of people, because of course men and women, we both have masculine and the feminine, they are able to connect a lot with this feminine energy, but also heal the masculine, because not always it's all about, you know, if I'm not feminine enough, or if I have maybe some trauma over here, maybe it doesn't come completely from the feminine side, but also from the masculine. So yeah, the medicine has this feminine energy because of how it works and the feeling that it has and how it has been worked in the jungle. But also, it doesn't mean that it's only going to bring this feminine side from you. It's going to bring a balance.
Hey, thank you. That perfectly answered many questions in the chat that I didn't quite know how to categorize. Thank you. We have someone asking what the difference is between participating in one ceremony and participating in four back-to-back, and why that's how we do it at Rythmia. Can you touch on that?
When we first opened, we had ayahuasca ceremonies every single night, and people could check in whenever they wanted to on any day. It was an absolute nightmare. It was totally chaotic. What we've learned in collecting data on outcome results is that if we have people check in on Saturday or Sunday and start off with Monday as a gentle introduction to the ayahuasca, which is the intention of that night. And then number two, going emotionally deeper Tuesday night. And then Wednesday, the feminine healing energy night. And then Thursday, the Colombian tradition to tie up loose ends and final resolve of whatever intentions you're working on. That process, because we've measured it, creates the best outcome. So if you go to one only, you're going to get a lot out of it, but you're not going to have the full experience. And so our data shows that going through that whole process gives you the best results. And we're constantly fine-tuning our program based on what the guests are going through. And that's how we've built this program, based on everybody's outcome data and what they're attending and what they're not attending and how often they're going or not. And all of that's based on a very regimented protocol that we're collecting. We have 650,000 data points that we've collected over the years based on attendance and outcome results. So that's pretty much why it works best to go to all four of them.
And also depends a little bit on what you're carrying with you. Sometimes when you come and you have like all this emotional baggage, the first ceremony can be like confusing, or it can be the medicine just chipping the outer layers, trying to get in. So that's why we have created this process to really go deep, because at the end, people that are coming here, they want a life-changing experience. So that's what the Rythmia Way is giving.
Mm-hmm. And we just had someone ask, so there is no hangover or recouping after a session. Can you touch on that?
You're tired. You're tired, but that's okay, because being tired is part of the process. You're hungry, you're tired, you're a little bit agitated, you're uncomfortable, but then you're also have joy, breakthroughs, awareness. It's a mixed thing happening. And there's plenty of time to take a nap. There's plenty of amazing food. There's plenty of coconut water and pineapple water. I mean, it's just amazing stuff here to replenish yourself. So you're not hungover in the sense that, like, you know, I'm like an alcohol hangover. There's nothing like that. There's not like or when people do club drugs like MDMA and they're crashed for 3 days. It's not like that. This is all organic. It's good for you if you're medically cleared, and you have this sort of calmness about you. And people, I mean, every morning on Thursday when I teach my class at 9:30 in the morning, the room is full, and I'm always shocked, because they've been Monday, Tuesday, Wednesday in these ayahuasca sessions, and they've been up late, but they're all there, and you have this different sort of energy, and you're definitely not hungover.
And I think also there's something important about this tiredness, that it's just like lowering your guard also. Like when you're tired, it's this type of tired that is not like not functional at all. It's like you're functional, but maybe you're a little tired. It's like also a way to like lower your defenses a little bit, and like surrender. It's easier sometimes to surrender when you're like tired. So
yeah, like your ego has been built your whole life out of experiences you've had to keep you safe from repeating things that hurt you. So your ego is really strong when you're well rested and you're well fed, or you're not hungry and you're not agitated. When you're feeling really good, that's when your ego is at its strongest. But you want to reorganize your ego. That's a part of this process, because parts of your ego are holding you back from trusting others or being vulnerable in a way that's healthy. So your ego is blocking that. So when you're tired a bit, and when you're going through this stuff, that, you know, Rythmia, it's hard. Your ego is a little bit lowered, and then you can actually have breakthroughs. So that's a big part of the process.
Thank you. So another question on the process, Evelyn, going to answer your question here. When you're on a trip, does it feel like you're in an eternity? Can you talk about the distortion of time if that happens?
Well, that depends on each person. Definitely the distortion of time can come into play when you're drinking ayahuasca, depending how deep you are, or how, and again, like every night is gonna be different. At some point you're like, oh my God, I've been here for 2 days, but then it's like, oh, it's been 5 minutes and ceremony's over. So definitely there's a little component to that, but every time and for every person is gonna be completely different.
Yeah, I think it's kind of like a lucid dream. Like you're aware that you're drinking ayahuasca, you're aware that you're at Rythmia, but you're kind of guiding the process a bit, you're navigating it, but then you have these breakthroughs and these clarities, and you kind of lose track of time usually, you know, and the night goes by really fast, you know.
Yeah.
So I don't think that you get stuck in like an eternal, I mean, it might feel like that for a few minutes, but it's short-lived, anything like that.
And something very interesting also, it's how maybe at some point you can feel like you're very deep, like just in your process, and then like you feel the urge to go to the bathroom, and then you're like sober and can walk to the bathroom. So also it's like it even changes during the same night.
Yeah.
And can you touch on how depression and other emotions can actually get physically trapped in the body, and then how ayahuasca helps to relieve those?
Well, that's that whole psychosomatic component of health. And so if you bottle up anxiety your whole life, or bottle up depression and just like hold it in and don't release it and don't talk about it, or don't use the tools you have to kind of process it all, you just hold it inside and bottle it up. Data shows in medicine that you're going to develop a physical symptom. Some people develop abdominal tightness with depression, or back soreness. Other people develop cancer and autoimmune disorders. So they don't know exactly how it's related. They believe there's cortisol involved, cortisol levels, there's hormone levels involved, there's neurochemical things involved, there's releases of endorphins and adrenal glands involvement. All this kind of stuff gets involved in a fight or flight mode, a survival mechanism. So if I want to run because I'm scared, I don't want blood to be in my limbs. I want it to be internally so I can survive and protect myself. So like there's all these like biological reactions that happen with an emotion, and it's for survival and for getting through things. And so if I'm in a constant mode of survival because I'm in an abandoning, abusive, traumatic environment, or I have a job that's just a nightmare, and every day I'm just under this horrible pressure, then I'm going to develop a physical symptom because my cortisol levels are high, my dopamine, serotonin levels are out of whack, and I'm probably self-medicating with like a bunch of caffeine and probably alcohol and who knows what else. And so all of that is like a perfect storm to be unhealthy and create physical symptoms.
And how does ayahuasca help to relieve all of that in someone during ceremony?
Yeah, well, ayahuasca,
Purging.
yeah, you purge it out because the ayahuasca goes into your body and finds these areas where you're storing emotion, and it releases them. It shakes it loose. That's why people often in ceremony report their limbs are moving around. They feel like they're kind of like agitated, like, you know, with their body, like electrical impulses happening. And all of that is a release. All of that is what's going on.
Oh, and that's the sign. Thank you, Dr. Jeff. That's the sign that the the cameras are running out of battery.
Okay.
So
Exhausted.
that's it. Well, everyone, thank you. Dr. Jeff and Mariana, even though we can't see you, is there any final words for the group before we sign off tonight?
That was awesome. I loved it.
Yeah,
That was super cool.
it was really nice, and also being able to, you know, answer to as many questions as people have, coming from all the way from depression to the divine feminine. Because I know that when it comes to ayahuasca, people have a lot of questions. So it's good that it's moving it out there.
Yeah, and I think, you know, what's important for me at least is that, you know, I was trained for 18 years in a Western model of mental health therapy and medicine and healthcare. And I was hitting dead ends with all my patients. Like we would stabilize them and then that was it. And they would just be on the same sort of level for decades. And so what I love about this is that it actually helps people move past those things and get real healing because it empowers the individual. So I left everything I was doing at UCLA, at Malibu, in my private practice in Pasadena, and all this stuff I was managing in the hospital and different stuff. And I came down here to do this because I actually see results. It's incredible.
Man, it is. It is. And thank you. Thank you both, Dr. Jeff and Dr. Mariana, so much for presenting for this, for sharing your experience, your wisdom for 2.5 hours with all of us.
That was awesome.
I'll just close up the call with my gratitude for Rythmia. While I'm on staff here, like most of the people on staff, we all ended up here because we experienced the medicine and it changed our lives. It changed who we were. Yeah, I feel like I was able to keep all the good and just get rid of the things that weren't me. I was able to get rid of the things that I not even the things that I didn't like about myself, but the things that weren't myself, right? And I wouldn't have even had that language or understanding before Rhythmia. So I hope that this discussion, that this chat was helpful for everyone on the call. If you have any questions, we can't get to all the rest of them now, but please just reach out to the guest consultants from the links that we shared in the chat or on our website, and they will answer all of your specific questions. And hopefully we'll see you on site at Rhythmia. It's always a great experience to meet guests and to meet people on site that are participating in the medicine, who, you know, walk up to Dr. Jeff and say that they see his Monday sessions that he does on Facebook all the time, or to say that they watch these webinars. That helps us to know that the things that we're doing to share the message, to share the medicine, and to share ayahuasca with people, and the Rhythmia program are actually making a difference. So everyone that's been on the call tonight, thank you so much. Honestly, I'm amazed that we have over 100 people still that stayed with us for 2.5 hours. This has been a great night for all of us. So thank you so much. And we look forward to seeing you at Rhythmia. If you have any questions, please don't hesitate. Reach out to the guest consultants. They're here on call from like all the workday. I don't remember the exact hours, but 6 to 6. And then you can schedule with them if you need to schedule in an individual time. But we appreciate you. We're grateful for you. Dr. Jeff and Mariana, thank you. This has been a great night.
Thanks everybody for watching. It was awesome.
Yeah, thank you so much.
We look forward to seeing you here in Costa Rica.
Yes.
Pura vida.
Pura vida.